A very good evening to one and all. On behalf of IAP Digital Media team, I, Dr. Abhishek Sahu, welcome you all to the COVICON 2020, organized by IAPWC Bihar. We are streaming live on IAP India YouTube channel. I request you all to subscribe to this channel to get regular notification of our webinars. You can also follow the IAP updates on various social media platforms such as Facebook, Twitter, LinkedIn, and Instagram. Now I request our panelists to take over the webinar.
हाय एके रेचल हाय बॉडी माइक कैसे हो तुम लोग हम सब ठीक हैं एके तुम्हें इस हालत में देखकर बहुत तकलीफ हो रही है हम यहाँ पर है इस बात की खबर ना तो चीफ को है और ना ही बाकी टीम मेंबर्स को तुम्हें यहाँ से सुरक्षित और सही सलामत ले जाना ही आर्यन का प्लान है उसी ने हमें यहाँ भेजा है इस वक्त हमारे लिए सबसे जरूरी है आपकी बेगुनाही
I request all to please go on mute. Thank you. Hello everyone and a very good evening. Thank you for taking out time today and joining us for today's COVICON 2020. I am Chandini. I will be the IT facilitator for today's COVICON and will be there to assist you throughout the COVICON. So before we kick off, get started with this, let's all stand for our national anthem.
शुभ नामे जागे तब शुभ आशीष मांगे गाहे तब जय गाथा जन गण मंगल दायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे
Thank you. IAPWC Bihar has organized this COVICON, which gives us a platform to connect with entire medical professionals under single umbrella. For a hassle-free COVICON, please follow the instructions which I am reading out. Sit in a quiet location where you will not be disturbed. Use appropriate equipments. Please post all your doubts, questions on your right-hand side of screen in chat window. We will get back to all these questions at the end of the session. On this note, I would like to invite Dr. Smita ma'am, host and host for today's COVICON. Over to you, ma'am. Thank you. I'm just checking with Smita ma'am. Please bear with me for another couple of minutes. Sorry, we are facing some technical issues at Smita ma'am and I'm trying to resolve this. We'll get back in another couple of minutes. Yes, Smita ma'am.
I am Bihar. I am the history of India. I gave the world its first republic. I nourished Buddha to enlightenment. I gave world its best ancient university. My son Chanakya was the father of economics. Mahavira came out of my womb to found Jainism. My son Valmiki wrote Ramayana, the greatest epic. Rishi Sushasru, the father of surgery, lived on my soil. My son Vatsayan wrote Kama Sutra to treat of love. My son Ashoka the Great was the greatest ruler of India. I gave birth to Aryabhat, the great ancient mathematician. I gave Ashok Chakra that adorns India's national flag. My son Dinkar is the national poet of India. I gave the world first yoga university. I gave India its first president. I am Bihar. Ancient Bihar was a center of power, learning, and culture in ancient and classical India. Bihar, the ancient land of Buddha, has witnessed the golden period of Indian history. It is the same land where the seeds of the first republic were sown and which cultivated the first crop of democracy. Such fertile soil that has given birth to numerous intellectuals which spread the light of knowledge and wisdom, not only the country, but in the whole world. The state has its capital at Patna, which is situated on the banks of the holy river Ganga. The state, as it is today, has been shaped from its partition from the province of Bengal and most recently after the separation of the tribal southern region, now called Jharkhand. With that, on the land of Buddha, IAPWC Bihar welcomes you to join hands together under this roof called COVICON 2020. Life is not a matter of holding good cards, but of playing a poor hand well. COVID-19 is a journey, but you walk the road alone. There are many places to stop along the way and get nourishment. You just have to be willing to take it. Sometimes you can because you can, but you can because you have to do. Sometimes you have to care for that. Cure sometimes, treat often, comfort always. The only way to make sense of change is to plunge into it, flow with it, and join the song and dance. As traditionally, we start the event with God's blessing. Today we have with us Guriya Avinash Kumar presenting Sai Bhajan. So over to you, ma'am. Yes, ma'am. There was a fault. I mean, well, Chani, there was some problem with voice. It was not at all audible. We'll move ahead. We'll move ahead. We'll try to get connected once again. Well, just when the caterpillar thought the world was over, it became a butterfly and joined the dance. Today we have with us Lipsi Rani Sahu Jagdev, a well-known classical dancer from Bhubaneswar, presenting Thank you so much, ma'am. Now, I guess we have done our warm up. Life is so brighter when we focus on what truly matters. Remember to look up at the stars and not down to your feet. Well, try to make sense of what you see and wonder about what makes the universe exist. Be curious, and however difficult the life may seem, there is always something you can do and succeed at. It matters that you don't just give up. Dr. Ruchi Vashni, ma'am, IAPWC National Head, come Treasurer IAP, believes faith is daring to go beyond what the eyes can see. Don't lose hope. When the sun goes down, the stars come out. Welcome, ma'am. The show is all yours.
Thank you so much, Smita ma'am. But I can see Narendra Sinha sir here, and our honorable president will also be joining soon. So I would like for a few minutes, Jha sir has joined. Good evening, Jha sir.
Good evening. Good evening. Good evening, Sinha sir.
Good evening. Good evening.
Good
Good evening,
evening,
sir.
sir, and
Good
most
Sir,
evening.
welcome, sir.
sir, we were waiting for you to start, sir.
I'm
Now,
sorry.
for the star to be born, for the star to be born, there is one thing that must happen. Just as nebula must collapse, so collapse, crumble. This is not your destruction. These lines totally fit on the star of the show, Professor Dr. Sanjeev Kumar Jha, sir, President IAP. We are blessed to have you here, sir. Well, famous quotes: take risks. If you win, you will be happy. If you lose, you will be wise. If you don't like something, change it. If you can't change it, change your attitude. Because difficult roads often lead to beautiful destinations. Sir believes together we can. Over to you, sir.
Thank you, Smita ma'am. And I'm feeling like something, a new person who can anchor the IAP conference.
Thank you so
And
much, sir.
and a new personality has emerged up, and that's good. First of all, I should say a big thank to IAPWC and Sinha sir, Ruchi madam, Reena madam, and all the person who are directly or indirectly associated with IAP, WC and IAP Bihar branch. Let me tell you one thing. Yes, you are saying right that the person who wants to take risk, nobody can achieve anything unless and until you take risk. So yes, very rightly said, Dr. Smita, that we need to take risk. We need to take the risk and take the fruits to distribute it to our members, and that is very important. And whenever we are trying to do that, you know that there can be many ifs and buts, there can be so many excuses, but one thing we all should remember, that the person who wants to do something will not have any excuses, and the person who wants not to do anything, they will have 100 of excuses. So the moment you start having excuses means you don't want to do something. So that is very important. And this COVICON conference, seminar, whatever you say, the way IAP Bihar team is doing the things, the way profession is getting roots in all the villages, even the smaller cities. I am very happy to see that. And I am very happy to see the hard work of Sina Saab, you, and everyone who are directly associated with IAP, because see, this is not a one person's job. And we should understand, I think last time when I visited Patna, I had a very big discussion with Reena madam and Sinha sir. And we all should understand that the only thing we should remove from ourselves to gain something. मैं एक हिंदी में एक बड़ी अच्छी एक वाक्य लिखा होता है हर जगह कि अगर आपको बड़ा बनना है तो लोगों के लिए काम करना शुरू कर दीजिए. जिस दिन आप लोगों के लिए काम करना शुरू कर देंगे, उस दिन आप अपने आप बड़े बन जाएंगे. आपको किसी को बड़े बनाने की जरूरत नहीं है. तो सिर्फ एक चीज जो है वो मैं अक्सर बोलता हूँ, अर्जुन की आंखें होनी चाहिए और टारगेट आपकी तीर की वही होनी चाहिए, ध्यान कहीं भी हो तीर वहीं जाके लगना चाहिए। सो ये तरीका है। और मैं समझता हूँ बिहार तो मेरी जन्मभूमि है और मैं उस प्रदेश से बिलोंग करता हूँ, तो मैं ये मानता हूँ कि ये मैं उस भूमि को बिलोंग करता हूँ जहाँ से बुद्ध, जहाँ से सारे बड़े, चाहे हमारे महावीर हों, सारे बड़े लोगों का जन्म हुआ। और ये एक ऐसी भूमि है जहाँ से हम ये बिलीव करते हैं कि लोग हमेशा कुछ नया कर गुजरने की क्षमता रखते हैं, और उस नया कर गुजरने की तमन्ना को दिल में रखते हुए और इस बात को दिल में रखते हुए कि हम सब प्रोफेशन को आगे लेके चलेंगे, इस बात को दिल में रखते हुए कि हम सब एसोसिएशन को आगे लेके चलेंगे, और इस बात को दिल में रखते हुए कि जो भी कहेंगे सही कहेंगे और जो भी करेंगे वो सही करेंगे, और उसके बाद जो रास्ते में आएंगे उनको भी हम सही करेंगे, उन सब को लेकर चलेंगे आगे। और ये बात ध्यान में रखेंगे कि हम लोग सब एक टीम है। देयर आर पॉसिबिलिटीज दैट वी हैव अ डिफरेंस ऑफ ओपिनियन, but difference of opinion is always welcomed in democracy, so there is no problem at all. Have difference of opinion, go ahead with your all jinx whatever you have in your heart and mind, and keep signing, keep moving. And I believe that the coming time, coming era, another 10 years is going to be very crucial for our profession, and we are going to get whatever we desired. मेरे हिसाब से सिन्हा सर ने जो 60 साल में पिछले हम लोगों ने स्ट्रगल देखा पिछले 30-40 सालों में, इस स्ट्रगल को हम ख़त्म शायद करने वाले हैं इसी पीरियड में। ये बहुत इम्पॉर्टेंट समय है। ये मैं एक समझता हूँ कि कोरोना की वजह से हर चीज़ एक नई करवट ले रही है, और हमें किसी भी करवट से परेशान नहीं होना चाहिए। हमें उस करवट को किस करवट के साथ लेना है वो अंगड़ाई होनी चाहिए। उस अंगड़ाई को ध्यान में रखते हुए अपने सारे कर्मों को, अपने सारे काम को अपने हाथों से उसको, क्योंकि हम फिजियो है, वी नो हाउ posture behave. So the way the time's posture is moving, we are 100% sure that we physio will control this time, will try to move ahead with the time and take this profession, take this association ahead. And I am really thankful to Smita ma'am, to Sinha sir, and to Reena madam and everybody of IAPWC. Really a big thank. Keep changing the world, keep changing Bihar, keep changing Muzaffarpur, and keep changing everything comes around you. Thank you. Thanks a lot.
Thank you, sir.
Thank you so much, sir. Thanks a ton, sir, for such an overwhelming speech. The only way to make sense of change is to plunge into it, flow with it. Well, now comes the lady with the smile on her face, Ruchi ma'am. Now your turn comes up. So please.
Good evening, one and all. Good evening, all the esteemed panelists in the inaugural ceremony of COVICON 2020. मैं सभी लोगों का, जो जितने भी यहाँ पर व्यूअर्स हैं, पार्टिसिपेंट्स हैं, जो हमारे साथ वर्चुअल प्लेटफॉर्म पे हैं, जो हमें पैन इंडिया यूट्यूब और अदर माध्यम से देख रहे हैं, दूसरे माध्यम से देख रहे हैं, और बिकॉज यहाँ पे हम लोग के साथ इंटरनेशनल स्पीकर्स भी हैं, सो आई एम एक्सपेक्टिंग इंटरनेशनल ऑडियंस एज वेल फॉर दिस कॉन्फ्रेंस. फर्स्ट ऑफ ऑल, thank you so much to our organizing secretary Smita Singh ma'am to come up with this initiative, क्योंकि आप एक यूनिक चीजों को जोड़कर इस तरीके से यूनिक भी नहीं कहेंगे, कोविड-19 से हम सब लोग किसी ना किसी तरीके से जूझ रहे हैं, फिजिकली, इकोनॉमिकली, इमोशनली, फाइनेंशियली, इतने सारे चीजों से हम लोगों को, फिजियोथेरेपिस्ट को कई लेवल्स पे जूझना पड़ रहा है इस समय। और ये सारी परेशानियों को आपने ब्लेसिंग इन डिस्गाइज बना के इतने अच्छे से गार्लैंड में डाल के और प्रेजेंट किया। और ये अब आने कल भी ये चलेगा जो सारा स्पीकर्स का, देयर आर जेम्स, और मैं सभी को बताना चाहूंगी एक से एक बढ़ के स्पीकर्स हैं इस कॉन्फ्रेंस में, which is commendable, mind blowing। और हमारी सेनानी, हमारी डॉक्टर रीना श्रीवास्तव मैम, हमारी जोनल हेड आईएपी विमेन सेल ईस्ट जोन, जोस्नी मैम, आवर एक्स स्टेट कोऑर्डिनेटर पूर्णिमा एंड करंट आईएपी ईसी बिहार, रिस्पेक्टेड सिन्हा सर, सभी सीनियर पैनलिस्ट, आप सब लोगों को मैं तहे दिल से धन्यवाद करना चाहती हूँ, बिकॉज एज एन ऑर्गेनाइजिंग चेयरपर्सन ऑफ दिस कॉन्फ्रेंस, आई थिंक यही एक ऐसी कॉन्फ्रेंस है जिसमें मैं बैठ के देख रही हूँ सब कुछ। अदरवाइज हम कॉन्फ्रेंसेज में बैठना इतना आसान नहीं रहता, बट दिस इज अ न्यू वे ऑफ कनेक्टिंग, शेयरिंग द प्लेटफॉर्म विद ईच अदर। इट इज अ ग्रेट मूवमेंट फॉर बिहार, क्योंकि कहीं ना कहीं मुझे ऐसा लगता है कि अगर बिहार में ये हो रहा है तो ये देश में हो जाना बहुत इजी है। विद ड्यू रिस्पेक्ट टू ऑल द मेल्स हियर, मुझे ऐसा लगता है कि अगर विमेन यहाँ पर इतनी स्ट्रांग है तो बाकी कंट्री में बहुत मुश्किल नहीं रह जाती है सिचुएशंस, बिकॉज इट इज वेरी डिफिकल्ट देयर फॉर अ विमेन टू फाइट ऑल द ऑड्स, कम अप, इतना स्ट्रांगली अपने आप को प्रेजेंट करना, इतना स्ट्रांगली अपनी बातों को रखना। और जैसे कि स्मिता मैम ने कहा था कि yes, we can, definitely we can, because the word no itself means next opportunity, the word fail itself means was first attempt in learning। तो अगर हमारी अगली अपॉर्चुनिटी हमेशा आगे है, सो आई डोंट थिंक कि जितनी भी यहाँ पे गर्ल्स, जितनी भी यंग फिजियोज हैं, फीमेल फिजियोज हैं और यंग बॉयज हैं, उनके लिए मैं कहना चाहती हूँ कि अगर यहाँ IUPWC, जब हम लोगों ने अंडर द लीडरशिप ऑफ संजीव झा सर एंड एंटायर IUPCC 2018 में IUPWC वाज फॉर्म्ड, और उस टाइम ये किसी ने नहीं सोचा था कि आज इसको इतना ब्यूटीफुल शेप, हमारे शीरोज, वी कॉल देम शीरोज बिकॉज दैट इज शेरनीज प्लस हीरोज, सो दीज आर आवर हीरोज। और इन लोगों ने जिस तरीके से ईस्ट जोन को, बिकॉज समवेयर डाउन द लाइन आई फील कि बाकी जोन्स और ज्यादा डेवलप थे, बाकी जोन में और ज्यादा रिप्रेजेंटेशन और वॉइसेस ऑलरेडी थी, और ईस्ट जोन में कहीं ना कहीं वो लैक कर रही थी, वो फीमेल वॉइस लैक कर रही थी, उनका रिप्रेजेंटेशन कम था कंपैरेटिवली। बट द वे इन द लास्ट 2 years the things have been shaped up, I really say कि it's really, आप लोगों ने बहुत अच्छा काम किया हुआ है। एंड सिन्हा सर हैं, झा सर हैं, जिन्होंने कभी भी सर ने बोला कि मतलब किसी हम लोगों को कभी भी पीछे नहीं हटने दिया, दे हैव ऑलवेज गिवन अ फ्रंट स्टेज, हम लोग आगे आए, हम लोग अपनी क्रिएटिविटी, अपने इनोवेशंस को आगे ला सके। So similarly with for all the girls, I say these are the policy makers, these are the true policy makers because they will never let you down। हम लोगों की फीमेल की काफी सारी स्टेजेस ऐसी होती हैं जब आपको लगता है कि you give up the things, you leave it and look after your family। प्रोफेशन नहीं हम उतना समय दे पाते, नहीं ध्यान दे पाते, बट ऐसे सीनियर्स की वजह से हम लोग आज यहाँ हैं, और हम आप लोगों के लिए एज अ पॉलिसी मेकर खुद भी अब एक रिस्पॉन्सिबल पोजिशंस पे है। और हम लोग चाहते हैं कि जितनी भी यंग गर्ल्स हैं, दे नेवर एवर क्विट, दे नेवर एवर गिव अप। ये याद रखो, कभी भी मुश्किलें कम नहीं होती हैं, चैलेंजेस कभी जाते नहीं है, इट इज जस्ट दैट चैलेंजेस हमें चेंज करते हैं, चैलेंजेस हमें स्ट्रॉन्ग करते हैं। नो, डिफिकल्टीज आर लाइक अनियन, जब आप पील करते हो तब आंसू आते हैं, लेकिन जब आप उनको खत्म करते हो तो अंदर कुछ नहीं होता। सो दिस इज लाइक लाइफ, जो कि परेशानियां लगती हैं कि होती जाएंगी, बट व्हेन यू आर डिटरमिन्ड यू कैन सॉल्व इट, और खुद से डिटर्मिनेशन आना चाहिए। देन देयर इज अ रोल कि हम लोग सब हैं to support all the youngsters, to all the young females of Bihar और नॉर्थ ईस्ट स्टेट्स जो हमारी इतनी स्ट्रांगली वहां पर यंग गर्ल्स, नागालैंड, मिजोरम, मेघालय, अरुणाचल, उड़ीसा, the girls are pretty young, guided by very senior women like Josni ma'am, Smita ma'am, Reena ma'am, Rita ma'am, they all are there to guide them। And then our seniors, जैसे हमारे सिन्हा सर हैं, Siti ma'am, Jha sir, Anna sir, they all are there. So with this conference, मैं चाहती हूँ कि अब एक ये नई शुरुआत हो जैसे बिहार में हुई है, और हम ईस्ट जोन को एक स्ट्रांगली डेवलप्ड रिप्रेजेंटेड इंडियन एसोसिएशन ऑफ फिजियोथेरेपिस्ट का भी और फिजियोथेरेपी का भी इसको बहुत स्ट्रांगली रखेंगे, प्रेजेंट करेंगे. आई विश ऑल द लक to my organizing secretary and organizing team, Aparna, Jyotsna, all the girls who are there, Alpana, Chandni, meaning all those. सबको मैं नाम नहीं ले पाऊंगी, but you all have done a commendable work. Congratulations from my side, and thank you very much for inviting me. Thank you all. Thank you.
Thank you, ma'am.
Thank you so much, ma'am. Light yourself on fire with passion, and people will come for miles to watch you burn. So, same goes for you, ma'am. So, you are a person who has shown lights to almost, it will be not wrong to say that almost throughout the India. So, thanks a lot once again, ma'am. Now, well, Chinese are the culprits, but still there is one saying in China when written in Chinese. Now, the word crisis is composed of two characters. One represents danger, the other represents opportunity. Dr. Narendra Kumar Sinha, sir, professor, president of IAP Bihar, believes always bear in mind that your own resolution to succeed is more important than any other thing. Welcome, sir.
Thank you, Dr. Smita Singh.
So please bless us.
Good evening, everyone.
Yes, sir. So please bless us with few words, sir.
Dr. Sanjeev Jha, President IAP, Dr. Ruchi Varshne, National Head IAP WC, Dr. Reena Srivastav, Journal Head East Zone, Dr. Smita Singh, Organizing Secretary IAP, speakers, teachers, students, and all the participants. It is my great pleasure to welcome all of you on the occasion of first international virtual conference of the IAP WC Bihar COVICON 2020. Dr. Jha is the explain everything about the professional status and profession. So this is the right time we get together to fight the right thing. Physiotherapy as a rehabilitation professional are the frontline healthcare professional, and their role is the very important in the case of the patient suffering from the severe case of the COVID-19. Physiotherapy may be beneficial in the respiratory treatment and the physical rehabilitation of the patients of the COVID-19. Patients recover comparatively more from the myopathies than the polyneuropathies, but with both conditions, there are the long-term consequences such as the weakness, loss of the function, loss of the quality of the life, and the poor endurance. A rehabilitation program educates the patients to improve therapy compliances and the self-management, and it is an integral part of the physiotherapeutic counseling. Promoting physical activities during the training program is the important to develop an independent active lifestyle from a problem-solving approach and the cooperation with the patients, which is really helpful for the patient to recover from the COVID-19. Today's world of the health services physiotherapy has an important place. Today, it is the need for the national level and the state level council of the physiotherapy to maintain the standards of the physiotherapy education and the practice. The proposed council is the name of the National Commission for the Allied and Healthcare Professional Bill 2020 as the recently introduced in the Rajya Sabha. We are thankful to the Minister of the State of the Department of Health and the Family Welfare, Government of India, Sri Aswani Kumar Chaube, carefully assessing our issue and giving his continuous support in the regard. IAP Bihar branch PT and OT State Council Bihar is almost in the final stage. We are quite confident to get success in our efforts in the near future. IAP Bihar branch is also demanding the admission to the Bachelor of the Physiotherapy course through the NEET, and the duration of the internship to increase from the 6 months to the 1 year, eventually the full course to the 5 years program. We are committed to continue our quest to gain excellence in our professional development in the future. While life is the full of the challenge, COVID-19 is the also one among them. We have to fight back with the having the 6 essential to be healthy and the happy in our life. The first is the sunlight, rest, regular exercises, good diet, self-confidence, and the good friends. This is the very important to our professional status. जो झा जी ने बताया कि हमें एकजुट होकर के इस मुकाम तक पहुंचना है और इसमें बाधाएं बहुत सी आती, और इन्होंने जो बताया वो सही बताया कि जब आप आगे बढ़ेंगे, अगर अच्छा काम होगा तो आपके साथ खौरा बनते जाएगा, लोग आपके साथ जुटते जाएंगे। और मैं तो यही कहता हूं कि एक छोटी लकीर के आगे एक बड़ी लकीर खरीद देंगे, खींच देंगे तो ऑटोमेटिकली वो छोटी लकीर दब जाएगी। हमारा प्रोफेशन में हर तरह के लोग हैं, तो उसकी परवाह नहीं, ये फंडामेंटल राइट है, डेमोक्रेसी है, हर आदमी को बोलने का अधिकार है और लोग बोलते भी हैं, तो उसकी परवाह नहीं करना है और हमें अच्छे कामों की ओर लग जाना है। और समझता हूँ कि डॉक्टर संजीव झा, रुचि वैष्णवी एंड होल टीम ऑफ द IAP जो अभी हम लोग जो काम कर रहे हैं बहुत राइट डायरेक्शंस में कर रहे हैं। हमें जरूरत है, लोगों को समझने की जरूरत है और कि हम कहाँ पर हैं, हमारा स्टेटस क्या है। और जहाँ तक स्थिति है, अभी फॉर्चुनेटली हम लोगों के साथ एक मंत्री जो हैं जो हर तरफ से हम लोगों के लिए तैयार रहते हैं किसी भी तरह का प्रॉब्लम को सॉल्व करने की। तो जरूरत है कि हम लोगों को यूनाइट वे में मिलजुल करके काम करने की जरूरत है। मैं डॉक्टर संजीव झा को और वैष्णवी तथा जितने टीम मेंबर्स हैं सबको धन्यवाद देता हूं, खास कर करके अस्मिता सिंह को जिसने बहुत पैमाने पर बड़ा ढंग से ऑर्गेनाइज किया है, और मैं समझता हूं इसमें काफ़ी इनका इंटरेस्ट रहा, काफ़ी रुचि लेकर के इन्होंने ऐसा किया। इसके लिए बहुत बहुत धन्यवाद देता हूं एंड आई विश ऑल द बेस्ट टू एवरीवन। थैंक यू।
Thank you so much, sir. We are blessed to have you as a guardian, sir. Once again, thanks a lot, sir. Well, pandemic is not a word to use lightly or carelessly. It is a word that is misused, can cause unreasonably fear or unjustified acceptance that the fight is over, leading to unnecessary suffering and death. While this is the first pandemic caused as a result of a coronavirus, it also is the first pandemic that can be controlled. PM Modi said, for a developing country like ours with a large population, the growing challenge of coronavirus is not a normal situation. India will move forward with full strength. That is my only wish. Reopening seemed to be more driven by political, economic, and public pressures, and frankly, fatigue. I think part of that is maybe in the way that we shut down, which is that many states shut down in a very short time frame, even though the epidemic was not surging in all of those places. So it increased the amount of fatigue that everyone had. Well, I think we are in a better place overall when it comes to COVID. That began said, I don't think that all of these interventions are the turnaround where we are not going to see any ICU level patients. I mean, even looking at the data, not all patients respond to remdesivir, and I know, and accordingly, not all patients respond to chronic. People with severe COVID-19 infection have rehabilitation needs in the acute, post-acute, and long-term phases of the disease. Many people who have suffered from COVID-19 may be at risk of long-term impairments or disabilities. Well, with that, I call upon Dr. Reena Srivastava, ma'am, Senior Physiotherapist, AIMS Patna. Ma'am is also Zonal Head East Zone, IAPWC. Ma'am, please come up.
First of all, very good evening, all the dignitaries and delegates present over here. First, I would like to thank Dr. Smita ma'am for giving me this opportunity to give a talk in this mega event, COVICON. So I want to share my screen and just a minute, ma'am. Ma'am, I'm not able to open my screen.
It should be in bottom of your Zoom app, ma'am. There is an option share screen.
Yes, ma'am. Share screen option is here.
Yeah, you can click on that.
From video clip.
You'll get a
But my
pop-up. Yeah, which asks to choose an application which you would like to share. You can select your PPT from there and hit on share button.
ma'am PPT option from where?
Once you click on share screen, you can
Yeah.
see a pop-up which shows which application you want to share. There you must be seeing your PPT. Is there? Or you can select the entire desktop option as well.
Ma'am, entire desktop option is where? Share in
Once you
share.
click, yeah, Reena ma'am, you can click on share screen.
Yeah. Already clicked,
You
ma'am.
get a pop-up, right? What you
Yes.
see?
Basic, advanced, or files.
Where is your file placed?
In desktop.
Okay, go to files.
Yes.
Do you see desktop option there?
No.
Okay.
No, ma'am. Just a minute.
Well, in the meantime, we can have one brush up. Chandni, shall we have 1 minute clip?
Sure, Smita ma'am.
हो मेरी सुबह भी तू ही हो शाम इस जुबान ते एक ही ना वो तेरा नाम है कठपुतली तेरी मैं जिवें मर्जी खेड लवी तेरे ਲਈ लड़ जू रब ना अजमा के वेख लवी तू हसदा है ते मेरा रब हसदा तेरे अंदर मेरा खुदा वसदा तू हसदा है ते मेरा रब हसदा तेरे अंदर मेरा खुदा वसदा माहिया तू वादा कर माहिया तू वादा कर कद दूर न जावेगा तू मेरे बाजों किते होर न लावेगा वे मैं तेरी हो गईया मैनू रोन ना देवी इना मेरी अखियां तो हंज छोड़ ना देवी
Yeah, Reena ma'am, we can see your screen. You can minimize this, yeah.
Yeah, I'm so sorry. I have taken too much time. Sorry, I'm so sorry. Yeah, today my topic of talk is acute phase of rehabilitation in COVID-19 patient. As you all know that countries all over the world are in various stages of pandemic, with many countries now entering the day after COVID-19 phase, patient with COVID positive, need of rehabilitation in all phases of disease. Yeah. Now we have divided phases of rehabilitation in three phases: acute phase, post-acute phase, and long-term phase. Acute phase, when patient with severe COVID-19 require hospitalization in ICU or critical care. Post-acute phase is patient
Sorry to interrupt, ma'am.
from the
Sorry, we are still
Sorry to
seeing your...
interrupt, ma'am. Ma'am, Rina, ma'am, sorry to interrupt.
Yes, ma'am.
We are not able to see your presentation, ma'am.
Ma'am, you can minimize this browser. It's still your Internet Explorer, and you can open up your PPT.
Ma'am, sorry again, browser.
Yeah, you can minimize this browser with where you have that mouse pointer over there. Just click on that icon.
Okay. Yes.
You can close your Internet Explorer browser and you can open your PPT.
Now. Ma'am, now able to see?
No, ma'am, we are still seeing your Internet Explorer.
Internet Explorer.
You can close your browser, ma'am.
Internet Explorer. Okay. Just a minute, ma'am.
You can try sharing your screen again, ma'am.
Yes, ma'am. Now. Yes, ma'am. Now able to see?
Yeah, it's loading up, ma'am. Yeah, we can see. You can hit F5. Yeah. We can see your screen, ma'am. Thank you.
Yes, ma'am. May I start, ma'am?
Please go ahead. Yes, ma'am.
Yes, ma'am. Already I have told you acute phase of rehabilitation. When patient with severe COVID-19 require hospitalization in ICU or critical care. Post-acute phase, when patient they transition from the acute phase to the post-acute phase, when patient who have recovered from acute respiratory effect of COVID-19 and shifted to ward or rehabilitation unit. And long-term phases when it's provided in community or home-based. Now, one question is there, why need to consider rehabilitation in acute phase? When patient admitted in ICU and in oxygen support, those whose illness may be complicated by acute respiratory distress syndrome, sepsis, and septic shock or multi-organ failure will typically require invasive mechanical ventilation in the ICU. Mechanical ventilation coupled with sedation, paralysis, as well as potentially prolonged bed rest and immobilization can develop so many complications. So we can cure the patient by an acute phase of rehabilitation. Acute phase of rehabilitation objectives is acute respiratory management, improving oxygenation, assist in airway secretion, help in weaning from PAHO, Pan American Health Organization given guidelines. Now, what's the benefit of acute COVID COVID-19 patient rehabilitation. So definitely it will reduce ICU-related complication, improve recovery, and reduce disability. Early discharge facilitation, reducing the risk of readmission to maintain their prior level of functionality and independence. Before starting any type of treatment with COVID-19 patient, we have to follow the standard guidelines and protocols given by Ministry of Health and Family Welfare or institutional based. We have to follow a step-by-step process of donning and doffing of PPE to avoid contamination. Our AIMS partner is also given a protocol of hospital infection and prevention control guidelines for COVID-19 patients. Now come to the symptomatic COVID-19 patient. There is 4 symptoms, maybe mild. If mild patient, maybe there is asymptomatic case. Moderate cases, there is no need of admission. It can cure in normally at home. But in severe cases where there is requirement of oxygen and inability to clear secretion independently and lower respiratory tract infection. And in critical cases, increasing oxygen requirement, fever, difficulty in breathing, frequent severe or productive coughing episodes. And if we are doing the chest X-ray, CT, especially for the fibrosis of the lung, we have to see in CT, and lung ultrasound, there is definitely changes in consistent with consolidation. In this condition, especially in severe and critical condition, there is recommendation of admission in ICU. When patient admitted in ICU, then our physiotherapy treatment pathway is classified according to the symptoms and treatment was patient taken. If patient is under mechanically ventilated, if mechanically ventilated, then sedated or paralyzed or minimally sedated. If non-mechanically ventilated, then patient with high flow oxygen, low flow oxygen, or a room air. So our total protocol of the treatment depend upon the worst patient under the treatment of ICU. Now come to the sedated and paralyzed patient. So our aim of treatment in sedated and paralyzed patient to minimize the complication of immobility and chest clearance. Definitely we are physiotherapists and our first aim, chest clearance. And in this sedated and paralyzed cases, so many times we have seen the guidelines that ho sake to limit the exposure of patient if required. Second thing is sputum inducing procedure require airborne position precautions, so need proper PPE kit with N95 mask. Yes. In this totally sedated patient, we will start respiratory physiotherapy, therapeutic positioning. Respiratory physiotherapy is definitely, it is a vital component to prevent atelectasis, optimize ventilation and prevent pressure zone. And prone positioning may improve lung mechanics, gas exchange, thus improving oxygenation in the majority of patients with acute respiratory distress syndrome and could improve outcomes. But we have to take precautions, all invasive lines, ventilator tubing to be taken care during positioning. And one thing is more that patients should not be disconnected from the circuit at any point of time. And passive movement of limb. I have a small video of passive. When patients, normally we are doing these exercises, passive range of movement exercises and the chest physiotherapy in ICU. Now come to the minimally sedated patient. Our aim is facilitate slow, progressive, early mobilization and optimize oxygenation. We will start chest physiotherapy, therapeutic positioning, facilitate weaning range of movement exercises, slow progressive mobilization depending upon patient hemodynamic tolerance and level of cooperation. It is really important to reduce the risk because any secondary infection will increase the number of days the patient is intubated and ventilated, and thus their overall time in the ICU, taking up bed space of longer than should be required. So we will start acute rehabilitation. And in this stage, we can also start the wheelchair ambulation. Now, come to the patient with high flow oxygen. High flow oxygen, maximum 60 liter oxygen, liter per minute oxygen we are giving the patient, and it has been found to be very beneficial at early stage. Our aim in high flow oxygen patient, enhance progressive mobilization and optimize oxygenation, respiratory physiotherapy, active range of movement exercises, and progressive ambulation depending upon the patient hemodynamic tolerance and SpO2. And one thing is very important, that is the negative pressure room or bed, preferable especially for high flow oxygen. Otherwise, it can cause the airborne infection chances is more as compared to ventilated patient. And before starting other exercises, we have to assess any comorbidities, conditions. Any comorbidities condition like hypertensive, stroke, coronary artery disease, or diabetes. Everything is dependent upon the patient condition, patient organs, failure, any history of. Patients with high flow oxygen therapy are observed to desaturate rapidly. It is important that all patients be continuously monitored and assessed before, during, and after physiotherapy session. This here is also a small video. We can start cupping, shaking, vibration in this state, but everything is dependent upon, because we have not tired the patient. Now come to the patient with low flow oxygen. Our aim of treatment in low flow oxygen to improve endurance and functional independence. We can start with incentive spirometry, flow based or volume based. It's depend upon the patient. Both are same. Use of resistive progressive exercises in this stage along with hemodynamics monitoring. Individualized exercise plan for each and every patient, but depend upon the tolerance level. Passive range of movement, active assisted range of movement, active range of progressive resistive exercises to maintain or improve joint integrity and range of movement and muscle strength. Bed mobility, sitting out of bed, sitting, balance sit to stand, walking, upper limb and lower limb ergometry exercises. We can start in this stage. And definitely airway clearance technique. And one thing is more important, which I miss, that suctioning should be performed using a closed inline suction system. And in low flow oxygen, and after that on room air. In room air, again, we will do all exercises as low flow oxygen, but we can improve the number of exercises. We can increase the number of exercises, but after room air, we can plan the discharge planning and home exercise protocol, post-discharge follow-up, and start tele-rehabilitation. At AIMS Patna, and definitely there is tele-rehabilitation unit is there. Patient after the discharge from hospital, contact with us with tele-rehab. Now come to the therapeutic positioning. In COVID-19, therapeutic positioning is very important. COVID awake repositioning proning protocol called as CARP, C-A-R-P. In mild to moderate severity, as it can help in improving oxygen saturation, delay and reduce the need of intubation, intensive care in pneumonia due to COVID-19. If patient is not able to do proper prone positioning, then we can extend that semi-sitting or sitting position is favorable when proning not possible due to patient discomfort or obesity. It has been observed that not all patients benefit in prone, hence the best saturation position should be accordingly. Totally everything in corona, each and everything depend upon the hemodynamics and vital of the patient. If patient is not cooperative, hemodynamics changes after the exercise, suddenly we have to start all the exercises. And one thing is very important, that is the ability to coordinate
Looks like we have some technical issue at Reena ma'am end. Smita ma'am, over to you.
We'll continue. Once she gets connected, we'll have her again because it was a nice session and effective one too. Chandni, there is one request. Manas Sahu, he is in viewers group, so please add him into the panelist. He's having some issues. Get him connected.
Sure, ma'am.
Well, physiotherapists are critical to the rehabilitation efforts in all the phases of life. Rehabilitation has a positive effect on health and functioning, killing thousands each passing day. And the countries slowly try to get back to the new normal. The emphasis on physical and mental health is more today than ever before. And yoga, the ancient physical, mental, and spiritual practice that originated in India, has been generated a renewed appeal as being a proven tool for well being. We have with us today Yogacharya Manas Ranjanji from Hyderabad. He is a master trainer at Yoga Authentic. Hari Om Manas ji, how are you?
Namaste.
So please tell us something about your living in COVID pandemic, which will be fruitful for each and every one of us.
First of all, I'd like to extend my namaste and warm welcome to respected organizing body, Ruchi ma'am, Jhasak and Chinnasak, Smita ma'am, and many more behind the screen. It has been a fantastic work done behind the screen to organize such a huge level of networking, huge level of putting the professionals together. I mean, all aspect of professionals together, and it's not that easy tasks. Sometimes to see Smita ma'am is active till 12 to other part of the members. And thank you, Rina ma'am, for enlightening. Seeing those words, goosebump comes up. It was really enlightening to hear those words and technological aspect of it.
Actually, I'm so sorry. I cannot present properly because Wi-Fi signals was not there.
Now, ma'am, we have to live with technology now because with isolation, all these we have to live with technology, everything going on technology. And thank you so much for very fantastic presentation and enlightening with those statistics. That is very important, statistics and terms. So my association with Bihar is Guru Disciple Association. So I have been in Bihar School of Yoga, Munger, with doing my PG course in yoga in 2003 and 5. And from that time onwards, I just fall in love with Bihar. Bihar people are, just here. They live here, and wonderful people, wonderful environment. So I learned yoga. I didn't learn yoga. I got it as a blessing. Asana pranayam we learned, but yoga I got it as a blessing from Guruji, Swamiji, Swami Niranjananandji. So COVID is an eye opener for each one of us. Somebody seeing it as a business perspective, somebody seeing it as a challenge, and it just dropped on our head. The thing is, we are not prepared. We don't know that this is a massive massive mutable virus is activated. So otherwise our world doctors, our researchers, they're capable enough to neutralize any such things within a short span of time. Since it just dropped on the head, it's created pandemic, and it's a business. It's a pure business. It's a calculated business, creating a business opportunity for a very billion and trillion level, not a rupees thousand level, trillions level of business planned behind COVID. So that is the background. Let me present once my uh, a small slides I would like to present here. Whiteboard with the curtains screen. Sticky notes. Mail, let's say basketball profile. Oh, it's as basic is asking something else. Ma'am, can I present it which is already open in the desktop?
Yeah, you hit share screen option, sir, and from there you can choose your right.
Got it. Okay. Okay. Before we start the speak, these are the gurus which who influenced the entire globe, and Bande Guru Parampara. My salutations to all the gurus whom we have interacted, who blessed us, and who have been worked since the starting of the system and will continue. So I am Manas or Jignesh Mudgal, just a yoga student. I can't say myself teacher when I present, sit in front of these great personalities. So I'm just a student. So my perspective is completely bit Indian perspective. So how we can take a preventive approach to yoga. So Paraman Swami Satyanandji used to say, "Ki yoga is first preventive, then maybe rehabilitative, curative is yet to decide much." So let's me a little bit light on rehabilitative, preventive part of this. So our health system, Indian health system, believes in a complete being. The thing which I am seeing, you are seeing, that is material body. The being is completely a 5-layer being, which having a body made up of material. You can say protein, you can say mineral. It's material, completely material and perished. With time is perished. So the my energy, the prana shakti, old days, our by this they see the pulse of the prana, nadi. They see the entire system of disease. So that is another system key monitoring energy flow from the different part of the body. We could monitor or we could analyze, our consciousness could analyze where is the issue. Then mind. Beyond that, yoga sadhana, then another system of Indian medicine said that the Ayurveda is said that equilibrium of dosas. So that is our Indian system of medicine. So when you go to Western system of medicine, we approach the what visible, what is pain, what is symptom, how to neutralize or cure it. But Indian system of medicine believes in healing. Healing will be beyond the curing. After curing, it will be healing or transforming. So these are the concept of our medicine. So we have been missing on this conceptual approach. I'm preparing a little bit background of it. So in this conceptual approach, we have been missing since a long time whom we have to catch. I have to catch the hand, which is fractured, or I have to catch the being who caused the accident. So our approach is, in Western approach, if you take only physical approach, we are taking. But in the Indian medicine approach is a body, mind and energy approach, which Ayurveda speak about or holistic therapist speak about. And many of you also speak about. Then our system of medicine, Indian system of medicine, by this Ayurveda's healing approach, and so we are lacking now in those system of medicine is innovation. Innovation and statistic is lacking. Research and statistics is lacking. So another approach we have been missing as a teacher. I work with the schools, colleges. As a teacher, we are greatly missing is inclusive in education. The health is not included in our education system. The health and well-being is not included in our education system. Then anything come out, it is a big blast. It will be a big panic for us as a parent because our kids. So now the current education system start thinking how to include those elements, well-being, how to include our ancient cultures in our education system. That helps us to connect our past system because these treatment system created as for our living. So we live in this Bihar, we eat the Bihar food, and Bihar food created healing element to our body. But if the Bihar food being eaten in Andhra, it won't be that effective because Andhra climate is different. So our missing approach to be corrected to face any kind of situation so that our body, our mind, our energy, our treatment system will be evolved with the time. So yoga, I see this is as an opportunity to develop a preventive measure and to re-establish our system. Normally, somebody say yoga, chalo वो सन्यासी हो गया, चलो स्ट्रेस में है योगा कर रहा है, नहीं चलो उसको कुछ सिद्धि प्राप्ति करना है योगा करना है. ये सारे चीज को छोड़ के we have to well-being, you have to redefine our sync, our equilibrium of body, mind and energy. So one sutra I would like to add here कि हठयोग प्रातिपदिका स्वातकम सेयित जत्र चलति मनसा तत्र चलति prana. I mean, where your mind goes, your energy follows that, and vice versa. What is the body here? Body is an equipment or instrument to act upon. Whereas the channel which is working behind is the energy. It may be in the form of prana or it may be a form of ATP. What we can understand, what we can say. Both are correct. So we say prana. The prana shakti which is moving around to make the things happen. And who is operating that? It's the mind. So the yogic approach is for prevention. It will be few approaches knowledge. We need the right knowledge to share with the people. You know, social media, mass media, everybody have n number of information with them. But as a professional, a right knowledge to be reached to people. Simple. This. Then we should focus on the prana utthana, energizing or aggravating the energy system in our body, the chakras, the prana, pancha pranas. We have to aggravate through our practice day to day, bringing equilibrium. And stress is nowadays a very hindrance to immune system. The daily stress has to be managed. Then how it will be some detailed practice has been I have placed. Detoxification needed. Kriyas, detoxification. We have a system of kriyas to detoxify like neti, kunjal, jalanti, sutraneti, tratak, shankhaprakharayan, vastradhati, many kriyas are there. And readiness to face. Since it's a contagious issue, anybody can be infected or it can be transferred from one person to other on the contact. If the contact happens, the person we have to, as a preventive approach, we have to build up our system, our energy level, our willpower to face it rather than get panic and fall into it. Getting ready to face up that with energy, with courage, with positive note in a mind. Yes, I have to do. I am ready for that. Fine, it's come. I am ready. My body is also ready. That will be more positive approach than Hi Ram, क्या करना है बोल के उसकी गोद में बैठ जाना जाके. In that way, we'll be just suppressing our entire equilibrium and bring a big mess to our equilibrium. So physical practice and yoga will be help the person in the preventive approach. It can be a collective approach. We can teach a mass of people to learn, practice, and apply. That is more useful. They can learn, they can practice, they can apply. So a lifestyle approach says that work-life balance is very important at present. So work, release, and have some personal time as well. You do work, I have to work, I have to find some time for myself, I have to relax, then I recharge myself, then go ahead. A holistic living, bit of yoga, a bit of exercise, a bit of passionate thing, which likes you. Maybe you are very good professional, but you are a human being. We need to love ourselves. We need to be happy. Some habit, something we need to keep ourselves engaged to get recharged to it. Sleep is one of the major hindrance for everybody. Now when work from home, sleep causes lots of disturbance in our equilibrium. Proper sleep heals and recharges us. Then positive thinking. Anxiety and stress together is a hindrance to any kind of therapy. So yoga acts here to handle the person's anxiety, maybe a collectively, maybe an individual. So there are few practices I put it forward here to handle those elements and to enhance person's prana shakti, to enhance person's endurance, stamina, to resist and to boost the immune system. So, Yamanyam contributes a lot to bring the code of conduct, personal and social code of conduct. So, Socha, which we say, Socha is cleanliness. It's from the years. Indian culture, in our family, nobody goes to kitchen with a shoe, and we don't eat the food by without washing the hand. So now people like suggesting wash your hand and do. So it has been our daily practice. So sanitation, mask, and social distancing to maintain the socho what currently we are using those terms. But we have been following that since years, thousands and thousand years. So that's why the cases are more, percentage of the cases are low in the India than US. So satisfaction is very necessary. The moment we get satisfied, our hawks running reduces. When the person is satisfied, the entire system is healed up. Santosh, chalo main khush hu, santosh. Or swadhyaya, self-analysis is very important here. I'm giving an example, before falling a smaller health issue or sickness, I get lots of alarming symptoms in my body. It may be deviation of energy level. So I could easily analyze and take a little bit more rest, apply food law to that, do a little bit more relaxing or meditative practices, pranayamas. So it doesn't affect much to my body or to my well-being. So swadhyaya is very necessary, and tapas is the regular practice, rigorous and regular practice for anything. Brahmacharya is self-restraint. So ahimsa meaning here exactly it will be. So ahimsa exactly meaning here will be non-aggressiveness towards yourself. Sometimes we do aggressive attitude, we take a wrong step. That to be through yoga we need to develop. So for pandemic prevention, these kriyas, three kriyas suggested. Kunjal is the kriya you have to drink water and vomit out. It will be cleans out the excessive mucus in your bronchus, and it also strengthens your lungs as well as in recoiling. And Jalaneti Sutraneti helps to cleanse the upper respiratory system, the nose and upper part. So Sutraneti depends upon, but Jalaneti and Kunjal should be practiced very regularly in the preventive mode once in a week, at least, or as needed. Coming from the asanas, the focus of the asana is the preventive mode to enhance energy level, to detoxification, energy circulation across the body, prana shakti across the body, and to maintain BMI. BMI maintenance is very important here. So starting from the smaller asanas like Pavanmuktasana, Sirjwanam to Bihar Yoga tradition, that to be practiced to initially to release out the joints and gastric system. Standing asanas, those helps, especially in the breathing enhancement, that to be practiced like Tadasana, Diryak Tadasana, Hastutthana and Padhastasana. It also helps to learn Surya Namaskar, and specific asanas which will enhance your energy, fire of energy, that is Manipur Chakra asanas must practice. Dogajar Nokasana, Dhanurasana type of asanas to be practiced regularly. and few asanas which specially focus on the Pran Shakti enhancing in the thoracic areas. Those are Ustrasana, Supta Vajrasana, Matsyasana, and Bhujangasana. These four asanas, either it can be combined Ustrasana, Matsyasana, or Supta Vajrasana and Bhujangasana. These are the asanas which help to expand the lungs a lot, increase the stretching in the throats, and increase the prana flow of the chest and throat areas. So Surya Namaskar, Paschimottanasana and Vakrasana, this is a supplementary asana to practice to maintain the sequence. Surya Namaskar must practice with breathing, at least starting from the 3 rounds. It really energizes your whole system. Surya Namaskar must practice with breathing. Complete ventilation. Surya Namaskar. Such a beautiful practice. At least 2 to 3 rounds, balancing. Now come to the breathing. So, yoga teachers focus on teaching pranayamas. Yoga teachers focus on teaching pranayamas. You want to learn pranayama, you come to me. I only teach pranayama. I only teach meditation. But the behind the pranayama is missing, whose lung capacity is not there, who doesn't know how to breathe properly, then what kind of pranayama will teach? Let teach students how to breathe properly, segmental breathing, diaphragmatic breathing, chest breathing, and clavicular breathing. In that way, the complete exercise follows by combine these 3 together called full yogic breathing. In a single breath, diaphragmatic, thoracic, and clavicular breathing will be combined. That is called full yogic breathing. When the person has that much lung capacity, he will be less susceptible to fall the negative effect of these infections. Negative effect will be there, but intensity will be low. Because his lung capacity, stamina in the lungs will be very high. Then followed by Kapalbhati and Nadisodham Brahmari. The pranayam should be combination practice. Kapalbhati is aggravating. Further, Vastrika practice. Those students who do Kapalbhati properly, Vastrika practice, I have been hearing Swamiji saying that those people who practice Vastrika pranayam, if you put poison on his body, it will be born out. Vastrika pranayam temperature goes beyond 100 when somebody practices Vastrika. Body temperature itself moves beyond 100 and it's very rigorous practice. One quick sample. You can see the flame, little bit flame also is thrown out of my lungs. Completely activate the pranic system in the entire body, Vastrika pranayam. But it has to be learned after Kapalbhati. So Nadisadhan Anlom Bilam to bring a balance in your nervous system, in your brain, hemispheric balance, in your nadis, it will be purified and balanced. Brahmari pranayam, it is quite useful to enhance your tranquility of the mind and deeper mental relaxation. Also improves controlled breathing activity. Brahmari pranayam. Next, come to after pranayam. Meditative approach is quite necessary. As ma'am told, Rina ma'am just saying that, prone position relaxation, that is a fantastic asana called Makarasana. Savasana, all of us know. Art of relaxation to be trained to our students, to our teachers, to our parents, to our patients, art of relaxation. Self-relaxation, it's just 5 to 7 minutes of self-relaxation in Savasana to be taught to everybody, followed by guided relaxation, Yoga Nidra and meditation. Yoga Nidra tapes are available in Bihar School of Yoga websites by Gurujis, it can be, or self-relaxation of 7 minutes in Savasana, starting from the body posture, releasing the muscular tension. These all relaxation based on biofeedback mechanism. All of us well aware of that biofeedback mechanism. Mantra chanting is quite useful. Om chanting, one of the satsang Swamiji was saying that, Om chanting was quite useful to strengthen your lungs, other than the meditative effect. So these are the bit preventive. And what is the role of the yoga teacher here? The role of the yoga teacher is to structure it. To structure it. These are the practices. It has to structure and given it to as a structure. In a video or a self practice or one-on-one practice, face-to-face practice, it has to be given as a structure. If not given as a structure, people will be confused and mess up with what they have to do. How the sequencing to be followed. And in fact, nowadays, honestly speaking, the number of students in our classes has drastically increased in the online. Not only the Indian students or local students, but also, abroad students have increased a lot. There are online classes happening through online connections. Lots of students have increased. So they have started realize it is another successful tool to prevent and prepare a little bit ourselves to be in a better condition. So also rehabilitation, ma'am already spoke a lots of the thing. So yogic rehabilitation happen only when the person go out of the hospital. In hospital, we can advise do is some little bit of relaxation or sometimes active or passive practice of smaller asanas like Pavan Mukta Asana series 1, later it's coming. It will be one-on-one approach. And ma'am is very, Rina ma'am is very clearly, represented those things. It will be one-on-one approach. Rehabilitation to be one-on-one approach. So this one-on-one approach will be done in collaboration with physician. Depending upon the risk factor involved, physical ability of the person, an expert yoga teacher has to sit either with eminent physiotherapist, a very specialized physiotherapist or a physician to design the program. It is varies from person to person. So the approach should be a one-on-one approach, body, mind, energy to restore the equilibrium which is just lost due to stress management is very important to help in healing. Need-based practice. What is the need there? Every person doesn't have the same need. What is the need there? According to the need, we have to add safe content. Sometimes yoga teachers they put चलो ये मत्स्यासन है मत्स्यासन कर लेते नहीं मत्स्यासन करने के लिए maybe they may not have that much physical ability on that point. The yoga teacher needs to think here how to give the equal benefit by modifying that machasana or use of the props there, tools and props to give a benefit of machasana which focus on the enlargement of the lungs and throat and maintain the flow of the breathing, free flow of the breathing. So ammonium similar process to be approached. So here little bit prayer is also needed to build the feeling the blessing. Blessing is important here. So a lifestyle as applicable for the situation because situation will be day to day, it will be different. We can't take a normal approach to the person who is hospitalized. So a kriyas here, one very kriyas to be taken as per the physical ability. Sutraneti kriyas with application of little bit antibiotic solution on it, it will be found to be very, very, very useful. Sutraneti normally will take the thread and move it around, normal thing. But here, applying little bit solution on it, antibiotic solution. It is very useful to reach the deeper part of the nose to heal the infection. Kunjal depend upon the personal stamina. Jalaneti in infection strictly no, depend upon the physical condition. So, so this is the pranayam asanas depend upon current scenario. The pranayam is if the person unable to do pranayam, normal breathing, Viloma pranayam to be practiced. Viloma pranayam is breathing with steps. Inhale little bit, stop. Inhale 3-4 steps, exhale in 3-4 steps. That is Viloma pranayam. With that, the breathing further improves little bit. If more need before, maybe 3 steps, tummy, chest, little bit so. Or active breathing practice. Supported breathing practice. But Mama's one of the slides was saying front and side as well. So this is Hastuthan series with breathing. This is found to be very, very useful. Or as required modification in the pranayamas depend upon the current situation. Savasana or Makarasan, if person improves further, lie down, Yoga Nidra, art of relaxation, one to be taught. And this is the time we need to work in a collaboration. Maybe we have a different perspective, but our objective is the same to bring the smile back in our friends around us. Let's live happily. Let's other people also live happily. So Paramburu Swami Sivananji has a few one line said that do good and be good. So if I am good, I need to also do good to people. So with all this approach can't happen in a single way. It has to be a collaborative approach and we need to work together. So medication and meditation is healing. So let's work in collaboration for healing, well-being and peace. So I'd like to extend my thanks to AIPAWC. It's a big people behind it for providing a platform and an opportunity to express myself and present my understanding and all this. So thank you so much, Smita ma'am and organizing body. It was a great experience to present. Thank you so much again. Hari Om Tat Sat.
Thank you so much, Manasji. You took me back in 2005. Well, very well explained. Could you please explain segmental breathing? Because here, see, when we talk about cleaning and nadi shodhan, and I mean, it becomes very complex for other people to do because we have learned yoga, we have been into it, so we know, right? But
Yeah,
for
yeah.
common people, it's very, very
Because
difficult.
Smita is saying this 15 minutes, I was not able to put the pictures and little bit elaborate. Maybe some other platform we'll be bringing in elaborative form.
Yes, exactly.
Elaborative form we have to bring it forward.
So you can just simply demonstrate once.
Yes, maybe demonstrative videos because 15-20 minute time the video once as on video it will take 2 to 3 minutes of time. It will kill away all the times because other speakers have in a weekend other speakers you should be given equal importance of the time. So we should
Very
give an
well.
equal opportunity to other speakers as well in the form of time.
Okay, then Hari Om will meet once again.
Okay.
Um, Addressing the nation on the Yoga Day, Prime Minister Narendra Modi said that yoga boosts the immune system of body. You must include pranayam in your daily life. Pranayam yoga or breathing exercises strengthens our respiratory system. It is more relevant in the current time as it is the respiratory system of the body that is most adversely affected by the COVID 19. As the physical activities have been limited, Drastically, over the past few months, yoga provides potential core benefits of both physical and psychological health. Well, the ancient practices of yoga, having started during the prehistoric times of nearly 5,000 years ago in India, is becoming a hallmark of modern day, best practiced for a healthier lifestyle in time of COVID-19 throughout the world. Well, with that, before we move ahead, we will once again join Reena ma'am as she was discontinued. So over to you, Reena ma'am. Please take up. Ma'am.
Yeah, sorry, I was discontinued from the slides. Now come to the normal ABG value, arterial blood gas. Sometimes hemodynamics of the patient is not stable. So we have to see the ABG, arterial blood gas values. There is, we will see PaCO2, pressure of carbon dioxide, oxygen, saturation of oxygen in arterial saturation. We have to see, and vitals हमें दिख रहे हैं स्क्रीन में कि हमारा 95% ऑक्सीजन दिख रहा है in 30 liter O2 we are giving. But when saturation of oxygen हम जब अपने arterial में देखते हैं तो maybe there is 60 liter, maybe percent, sorry, 60%. So we have to always monitor the arterial blood gas. And one thing is pulse oximeter is also not reliable. So now come to the severe COVID-19 complication. If we will not start early rehabilitation, complication is there, and very important complication in early stages, that is the ARDS, acute respiratory distress syndrome. मल्टी ऑर्गन फेल्योर, अगर ऑक्सीजन हमारी प्रॉपर अदर ऑर्गन्स में नहीं जा रही है, हम 60 लीटर ऑक्सीजन, 90 लीटर ऑक्सीजन, व्हाट एवर वी आर गोइंग, बट वो प्रॉपर लंग में जा रही है, हमारी लंग के थ्रू ब्लड सर्कुलेशन से, ब्लड सर्कुलेशन थ्रू आर्टेरियल प्रेशर के थ्रू अदर ऑर्गन्स में सप्लाई हो रही है. अगर नहीं सप्लाई हो रही, दैट मींस कि देयर इज चांसेस ऑफ मल्टी ऑर्गन फेल्योर, एंड also acute kidney injuries is there, and sepsis. So definitely, if long time bedridden, sepsis will also develop. Now come to the late complication. Late complication, if patient is long time in ICU or bedridden, there is definitely critical illness polyneuropathy will develop. In critical illness polyneuropathy, there is loss of movement, pain, distal or sensory losses there. And in polyneuropathy, patient when I have a great example of polyneuropathy, just a minute. Yeah, this patient is admitted in ICU for 17 days. Only in 17 days, patient develops CIP, critical illness polyneuropathy. Or this patient come with ARDS, acute respiratory distress syndrome, and present with CIP. It can cause several difficulties, such as difficulty in weaning from mechanical ventilation. क्योंकि एक बार अगर डेवलप हो गया तो डेफिनेटली पेशेंट मैकेनिकल वेंटिलेशन से वीन नहीं हो पाता है. Even diaphragmatic weakness is also there, atrophy of the muscles, and distal sensory loss is also there. And one thing is this, critical illness myopathy. In myopathy, weakness, loss of function, quality of life, and poor endurance is also there. And one symptoms is also there in late complication, that is the reduced muscle mass. Maybe because of the prolonged bed rest and immobility, part of causes of the loss of strength, and clinicians are seeing greater muscle loss compared to pathologies with similar ICU and bed rest time. So it may be related to specific COVID-19 viral load or impact of prolonged lack of oxygen to the muscle tissues, physiological reaction to longer period of increased inspiration and heart rate along with decreased partial pressure of oxygen. One most important syndrome after the admission in COVID इंटेंसिव केयर सिंड्रोम. नॉर्मल भी अगर पेशेंट हम आईसीयू में एडमिट होता है तो वो एक PICS सिंड्रोम डेवलप कर लेता है, बट इन COVID-19 देयर इज आल्सो अ साइकेट्री इशू इज आल्सो देयर. सो लॉन्ग टाइम आईसीयू पीरियड मे बी after the discharge from hospital, patient will develop month to year. In this, cognitive impairments, psychiatric illness, duration of sedation, age, hypoxia, and hypotension. All these reasons of post-intensive care syndrome. And last not the least, that is the physical impairments. Because of the pain, reduced inspiratory muscle strength, impaired exercise tolerance, severe fatigue, and low functional capacity can cause some physical impairments. Now come to the sequel of COVID-19 infection. Sequel may be cardiac. अगर हम start नहीं करते हैं, patient is admitted in ICU, and if we are not treating proper, taking rehabilitation, maybe patient develop. हालांकि there are no any research like this, but we think that there is sequel. Maybe arrhythmia, cardiac insufficiency, troponin eye elevation. Most of the patient have troponin eye elevation, neurological, in neurological headache, disturbed consciousness and paresthesia, musculoskeletal, physical deconditioning, ever muscles weakness, reduced joint mobility, impaired balance and gait, एंड पल्मोनरी डेफिनेटली यहाँ पल्मोनरी इन्फेक्शन सबसे ज्यादा होते हैं, जिसमें हमें लंग फाइब्रोसिस, अगर प्रॉपर ट्रीटमेंट. लंग फाइब्रोसिस में क्या है कि अगर एक बार लंग फाइब्रोस हो गया, दैट्स मींस कि डेड हो गया सेल्स, हम दोबारा उसे नॉर्मल हम नहीं कर सकते. तो बिकॉज ऑफ द एक्सरसाइज, ब्रीदिंग एक्सरसाइजेज एंड ऑल अदर एक्सरसाइजेज, वी कैन इंप्रूव द कंडीशन ऑफ द लंग. क्योंकि जिस एरिया में ऑक्सीजन नहीं जा पा रही है तो हमें उसको एयरवेज को क्लियर करना है. बिकॉज ऑफ दैट, एक बार अगर कुछ एरिया में अगर फाइब्रोस होता भी है तो अदर एरियाज हम बचा सकते हैं. And next is the cognitive, long lasting confusional state and psychological problem is there. Total graph is there. A patient is COVID-19 positive, then it develop lung diseases. It can cause also ARDS, acute respiratory distress syndrome, then comorbidities. It can develop maybe hypoxia. After the ARDS, hypoxia is there, neurological impairment. ICU में एडमिट होता है तो मैकेनिकल वेंटिलेशन, देन सीडेशन है, पैरालाइज्ड है पेशेंट, देन इमोबिलाइजेशन, क्रिटिकल इलनेस विल डेवलप. देन अब इफ पेशेंट इज नॉट एबल टू टेक प्रॉपर ब्रीथ, देन वी कैन डू ट्रैकेस्टमी, ENT surgeons do. Then these all are direct or indirect effect in COVID-19. Now come to the aspect to monitor closely in patient. What we will see, first thing is the cardio वैस्कुलर एंड रेस्पिरेटरी, जिसमें हमें जितनी भी एक्सरसाइजेस हमने करनी है, हमें पूरे टाइम जितनी देर भी हम पेशेंट के पास हैं तो वाइटल्स हमें देखने हैं, हीमोडायनेमिक्स देखना है, कार्डियोवैस्कुलर एंड रेस्पिरेटरी में सैचुरेशन ऑफ ऑक्सीजन. सबसे पहली चीज कि हमने पेशेंट की मूवमेंट्स किए, मोबिलाइज किया, सैचुरेशन ऑल ऑफ सडन सैचुरेशन फॉल होता है. सेकेंड थिंग, हार्ट रेट, ब्लड प्रेशर, टेम्परेचर, एक्सेसिव फटीग, चेस्ट पेन, सीवियर कफ, ब्लड विजन, डिजीनेस, हार्ट पाल्पिटेशन, स्वेटिंग, लॉस ऑफ बैलेंस. ये सब फीचर्स कोई भी नहीं मिल सकते हैं, तो वी हैव टू ऑलवेज आवर आइज ऑन वाइटल्स. सेकेंड थिंग, असेस पेशेंट रिस्पॉन्स ड्यूरिंग एक्टिविटी एंड मोबिलाइजेशन. पेशेंट कितना कोऑपरेट कर रहा है, जितना हम किसी भी एक्सरसाइजेस को जबरदस्ती नहीं करा सकते हैं. एंड वन थिंग दैट इज ड्यूरिंग पोजिशनिंग, all invasive lines, ventilator tubing during positioning we have to see. Now come to the safety recommendation for therapists. During aerosol generating procedure, should wear fitted respiratory mask along with PPE and eye protection. Aerosol generating procedure should be administered only when considered strictly needed for clinical improvement of the patient. If there is no need, please don't do aerosol generating procedure. And if we are doing, then avoid anteriorly, always put the posteriorly. And PPE should not be removed or adjusted and correctly worn for the duration of exposure to potentially contaminated areas. I have taken references from the European Respiratory Journal, evidence-based national consensus, physiotherapy management in COVID-19 in acute care, that is the Pan-American Health Organization, World Health Organization also given a guidelines after the COVID rehabilitation in self-management, home-based exercise programs. These all are the differences. Multi-team डिसिप्लिनरी टीम अप्रोच इज द की. डेफिनेटली जब हम रिहैबिलिटेशन की बात करते हैं तो रिहैबिलिटेशन सिंगल पर्सन का नहीं होता है, जिसमें हमारे मेडिकल फील्ड्स के सभी डॉक्टर्स, एनेस्थेटिस्ट, स्पेशली इन आईसीयू, सबसे ज्यादा जिनकी आज हमें जरूरत है दैट इज द नर्सिंग ऑफिसर्स, डाइटिशियंस, ऑक्यूपेशनल थेरेपिस्ट, इवन प्रोस्थेटिक्स एंड ऑर्थोटिक्स, सभी का एक मल्टी डिसिप्लिनरी टीम के साथ ही वर्क है. कोविड मीन्स ही मल्टी डिसिप्लिनरी टीम अप्रोच. Take home messages: keep up to date with information relating to the outbreak status and all regional and or national guidelines regarding COVID-19. Integrate rehabilitation into infection prevention and control measures and ensure physiotherapists use PPE appropriate to the risk of exposure, increase the surge capacity of the rehabilitation workforce, and promote well-being. Therapists need to weigh the benefits achieved versus harm to optimize treatment with a holistic approach. This last message is for अगर किसी पेशेंट में चेस्ट फिजियोथेरेपी, लिम्फ फिजियोथेरेपी का अगर कोई इफेक्ट नहीं हो रहा है या नहीं होना है, वी हैव टू असिस्ट द पेशेंट. तो डेफिनेटली डोंट डू. अगर बेनिफिट नहीं है तो डेफिनेटली हमें नहीं करना है. Thank you for your time. Thank you, Smita ma'am, for giving me again opportunity to present, complete my topic. Thank you so much, ma'am.
Thank you so much, ma'am. It was really a very um, informative session. Well, don't get hung up on the hard times, the challenges. Tell your story by highlighting the victories, because it's your victories that will inspire, motivate, encourage other people to live their stories in garden. They are working in the front line, managing patient screenings, placements, as well as the care of patients in the COVID zone. Nurses are working round the clock, pushing themselves in the limit and putting their lives on the line, very often with limited resources. We have with us Nitin Bhimrao Ingal from Pune, worked as a lecturer in Vijayasan Mohit Patil College of Nursing, and at present he is a medical um officer, I mean, a nurse officer in Government Medical College and Hospital at Pune. Over to you, Nitin.
Nitin, you are on
Good evening,
mute.
everyone.
Can you unmute yourself and speak?
Yeah, I unmute.
How are
Everyone
you
hearing?
feeling now? Yeah, you're audible. So
I'm
now, how are
fine.
you feeling? So he is a
I'm fine.
corona warrior. Just now he
Yeah,
has recovered and again is back to work.
yes, Mitaji. So before that, I would like to say thanks to AIPWC who give me one of the platform. As we know, I am from Maharashtra. There is long distance, but this technology brings us together. So I would like to start my topic. rehabilitation during and after COVID-19, role of nurse. We are knowing every health worker, even doctors, physiotherapists, everyone are working. So nurse is also having major role. Means what they are doing, they are not going only give medication. They are going to give supportive care to the patient. So what are the supportive care? So that I'm going to explain it. Rehabilitation, why needed in the nurses by to the patient, because we are seeing in this month there are rapidly increase of the cases of the COVID-19 cases where some patients get admitted in ICU and they're requiring they are struggling it and they're requiring the rehabilitation. Definition of the rehabilitation. According to World Health Organization, they give the definition of rehabilitation that rehabilitation is a combined and coordinated use of medical, social, educational, and vocational measures for training and retaining the individual to the highest possible level of the functional ability. What's happened in COVID stage? Person get disturbed. Principle behind it. Principle of the rehabilitation should be during initial contact with the patient. Mostly, patient should be active and activity of the living things should be facilitated to the patient. What are the problems? What are the problems faced by the patients during COVID-19? First is the fever, impaired breathing pattern, patient anxious about the health problem, self-care deficit to the health condition. So what about fever? Fever, we have to adjust the room temperature, means we have to put the fan on. If a patient is feeling more, then remove unnecessary cloth if person has. Apply the cold sponging, cold pack, and we should give antipyretic as per physician's order. Then give to the patient cooling mattresses. Then next is the breathing problem. We have to see vital signs, means we have to see the respiration with the help of the pulse oximeter. We should give firstly alternative position to the patient like semi-Paulus, high Paulus position. Depending on the SpO2, oxygen marks, NIV marks, phase 10, we should give. Then teach to the patient some breathing exercises. Then about self-care deficit. So we have to see the level of the anxiety. Give relaxation therapy to like music. Then we have to give encouragement, confidence to the patient. So he will recover soon. Then after discharge we are going to give the patient quarantine about 14 days in home. So how he should rehabilitate? It should be on two levels. First one is the individual level, then second is the community level. In individual level, person should maintain COVID behavior, means he should wear the gloves, mask, face shield. Then he should use sanitizer always. Use immunity booster like Chawanprash, Amla, Ashwagandha as per availability near to you. Then use steamer whenever necessary. Check your BP, temperature, blood sugar, then SpO2 as availability of the digital equipment. Then see for the sore throat, fever and cough. Do it warm water gargle, half teaspoon haldi with warm milk. Then we should take warm water as per capacity of the patient. We should do a breathing exercise like Anulom Vilom. Have adequate sleep and rest. Take medication if prescribed by the doctors. In the level of community, all the people should be encourage him or her by good wishes. If possible, use latest technology like we are using now, video conferences should share his or her positive experiences. Avoid speaking, strictly prohibited. Allow two person participate in group activity within a certain limitation. Last or least, with all of this health worker we are doing, so this is we are getting the fruit. India is leading to top country of coronavirus cases, but we are having recovery now. This time we are getting the recovery rate is 83.8. So I appreciate to all health workers like nurses, doctors, even physiotherapists, all are doing their as much as. Thank you.
Thank you so much, Nathan. Well, nurses have proved to be the health warriors who have taken on the responsibility very willingly with their heart and soul. The profession is central to tackle the pandemic, and nurses in every country have stepped up and stepped beyond their calling. The unexpected and unprecedented challenges brought on by the COVID-19 pandemic has inflicted Team One Group expected to work as usual in these trying times are healthcare workers, and therefore the impact of COVID-19 pandemic on the mental health of frontline healthcare workers is gaining legitimate attention. In this regard, we point out a few moral and ethical dilemmas that can be faced by healthcare workers. Well, now I invite Dr. Monica Srivastav. She's here with us today. She is an occupational therapist and she did her master's in neurology from AIIPMR. She has done her double master's in psychology from Madras University. She is working freelance OT consultant with Amrit Mascon Special School, Noida. Over to you, ma'am. How are you, ma'am?
Fine, thank you, Smita. I'm just connecting to my, yeah, just a second. Yeah. Can you all see me? Can you all see my slides?
No, ma'am.
Can you all see my slides?
No, ma'am, it's still, we can't see it.
Okay, okay, just a second. Just a second. Now is it visible?
No, ma'am.
No,
Okay.
ma'am.
Okay, okay. Yeah, one second.
You have this share screen option, ma'am, in your app. From there, you can select your application which you want to share.
Yeah, one second, one second.
Yeah, it's loading up.
Share screen, has it come?
No, ma'am, still we can't see. You can hit share screen option. Yeah, it's loading up, ma'am. Yeah, we can see. We can see your browser. Yeah, we can see your presentation, ma'am.
All right. Okay, okay, great. So greetings to all the respective members of the organizing committee of the IAP Bihar chapter, and to all those who have logged in to this conference. It is indeed a pleasure and an honor to be speaking here today. And well, there's a saying which all of you must have heard at some point or the other, that when the going gets tough, the tough get going. So conferences like COVICON 220 are steps in the right direction, because these are platforms which give you a lot of information in an organized manner. They offer solutions, and everybody works together on to try and get used to the new normal to provide good quality healthcare to people who are in need. So with that, I'd like to move on to my topic. We're I think already behind the schedule, so I won't really take up too much time. Um, my topic today is COVID-19, a healthcare professional's dilemma. Well, coming to the first part, it's the dilemma comes in when there is a challenge. So what exactly are the challenges that we as healthcare professionals, which includes occupational therapists, physiotherapists, speech therapists, the whole gamut of healthcare professions are facing? Some of them are specific to individual professions, and some of them, and most of them, I would say, are common. So we'll be more or less discussing the common ones here. And I guess the question answer session will come in later, from where you can clarify individual doubts. So, so before we go into details, I'd like to classify the kind of challenges into four types: professional challenges, personal challenges, academic challenges. And this includes people who students, and those who are in research, those who are teaching, and of course the unknown, our favorite idiopathic, which comes in all the list of causes. So right now, we maybe there are some things that we don't know, so I've kept this as an open-ended thing. So professional challenge, our biggest challenge, I think, that we're all facing today is that occupational therapy, physiotherapy, speech therapy are not considered to be essential services. So what do you mean by essential services? Essential services are those services which are mandatory even during a pandemic, okay, to basically maintain the health and the welfare of people. So if we can get the professions into the Essential Services Act, that I think will be the biggest victory of, or the biggest takeaway from this whole pandemic that is going on, that we would be recognized as essential services. And I think the discussion is on, and we do have a lot of advocacy groups, especially professional bodies like the IOTA, which is the All India Occupational Therapists Association, the Indian Association of Physiotherapists. Everybody is working towards that. There is no doubt that there is a role in the acute care, and all the therapists are required right from the beginning. And this entire conference is only highlighting the fact that rehab professionals are integral to whatever kind of setup, whether it's an acute care, whether it's chronic care, whether it is community resettlement, everything, it's integral. So certainly our role is mandatory in an essential service. So if we can get that, and if we can, convince the government to put us under essential services, that I think would be a very, very big victory for the professionals, for healthcare professionals. Well, the first step is we have to be convinced. I'm sure we are all, and then we need to convince others. We also need to identify the challenges within various settings, because not all rehab professionals work in an acute setup. There are various settings that professionals work in, which includes, besides hospitals, in rehab centers, there are private clinics, special school setups, integrated and inclusive education setups, teaching such as colleges. So these are the various professional settings that we are all involved in, and each has its own challenge that which it throws ahead, and we need to be very clear about how to handle those challenges in a different way. Well, the domains of concern, I think the physical domain of concern, this entire conference would be probably based on this. So I'm not going to really highlight or talk too much detail in it, because Dr. Reena has given us a beautiful presentation about the entire gamut of possibilities in the acute setup. And being physiotherapy professions yourself, this must be integral to you. So the physical domain would include respiratory care, swallowing. A lot of patients who are diagnosed with COVID, they do have swallowing issues like a lot of other patients who come in for acute care. Maintaining and improving strength and endurance, functional activities, including communication. So it is also imperative that once the person tries to maintain his functional activity as much as possible, even in an acute care setup, provided the safety concerns are taken into consideration. Cognitive. Now, this is something that as an occupational therapist, we would be very, very deeply involved in. Especially, I'm going to relate it not through the entire gamut, but only considering the fact that a lot of cases, COVID cases, are affecting the elderly people. And the elderly and the very, very young are at extreme risk for fatality. So in geriatric care, we know as a matter of fact that dementia is a major concern, and people of their elderly age group, they have a whole lot of comorbidities, and those comorbidities make them put them at a very higher risk of fatalities than the normal population. Also, the elderly don't want to go to hospital because they're scared that they'll never come back from that. And this is not something that only COVID has brought on. This is something that has always been there. So when you're dealing with an elderly person, you need to consider their sensibilities also, avoid unnecessary hospitalization, and take into account their fear factors and their comorbidities. And only if essential or you feel that, okay, there is no other way but to bring them to an hospital, then go ahead with it. Otherwise, if it can be managed by safety precautions or just by keeping them safe in their particular setups, believe me, they will definitely recover faster when they're in a familiar environment than in an unfamiliar environment. Of course, this is considering that they don't have major symptoms and they are not at risk for any kind of major symptoms also. um, uh, People in the elderly age group, and I personally, when we all have elders in the home, most of them you will find have difficulty in following complex instructions. For example, something like wearing masks. They're not comfortable with wearing a mask. For them, wearing a mask is like, what? Why are you doing this? We don't need to do this. So acceptance of basic safety precautions is something of a challenge with the elderly. Self-isolating, not allowing them to meet people, because this is the age when they want to meet up with with their own peers. They want to meet up with their family members, and restricting them from meeting up in person because they're not used to this kind of virtual domain. So they don't feel that talking on the talking face to face or doing a Skype call is something they're not very comfortable with. Of course, they're doing it now that they're also facing up to challenges, but they would rather meet in person. So explaining it to them that isolation, wearing of masks, something like repeated hand washing, to keep telling them that you have to keep washing your hands after 20 minutes. All these instructions, especially for a person with having dementia, these are major challenges. So this is where we need to also take that into consideration. A lot of elderly people, their symptoms may go unreported because they have communication difficulties. They are not aware of their own bodily sensation. They might just think that their little sniffle or their fever or their cough and cold is something that is because of the change of weather, or they have drunk a glass of cold water or something like that. So to make sure that it is nothing to do with COVID is also, don't understand that kind of the depth of what may be going on in their body. Swallowing difficulties, a lot of them have, so that of course leads to lesser food intake, and lesser food intake, as you know, could lead to additional issues of lowered immunity and dehydration, which further makes them susceptible to getting infections. The other aspect is the psychosocial. I think this is also going to be discussed. A lot of psychological issues that are coming up these days. because all of us have been used to a certain routine, getting up at a certain time, doing a certain, finishing of our work, getting our meals ready, going to work, or doing your housework. So we've been in a sort of a routine throughout our lives, and that's the only thing that we have known. And suddenly, in the current situation, everything has gone out of the window. You're getting up later, you're sleeping later, you're getting up later. uh, Something like basically maybe just taking a shower in the morning and getting into your work clothes is not happening. So our entire system, the routine that one has been used to, is not happening. So this is not only affecting your initially it's good, that first month it was like a vacation. But now, as the months go by, and we know this is not going away so soon, this is going to start getting on people, because the loss of habits, the roles, you're eating unnecessarily, you're staying at home, so you're always eating junk food, you're sitting on next to the TV. So all this is affecting uh, not only the professionals, but also people at large. So a lot of lifestyle diseases are going to see an upsurge because of these kind of changes in healthy habits, roles, and routines. Emotional well-being, stress management, very big thing, again discussed early in the earlier presentations. Not only of the patients, of course they are suffering because they are not being able to go through their special schools, or they are not being able to follow their routine the way they used to. And all that is having an effect on them, as well as the caretakers, who now are, because the caretakers would get a bit of space. If a special child had to go to a school, they would get that 2-3 hours to finish off their work. They would get their 2-3 hours to relax, but that's not happening anywhere. And taking into consideration that children are having a tough time, especially children with special needs, children with autism, ADHD, these children staying at home, they're it is taking a toll not only on the child, but also on the caretakers. So these are some challenges that we are facing. Vocational rehabilitation, a lot of jobs, laying off has been going on. There is not much work at hospitals, at schools, at clinics. There is reduced footfall, so work is not going on as it used to. So what do we do in those cases? Well, we have to help people find suitable online resources, try and identify what they're good at, what they can possibly do instead of what they're already doing. If they've lost a job, there is no need to get depressed about it. There are options available. They can do courses. There are a whole lot of online courses going. So all these kind of solutions have to be given to the people, so that that hope factor is still maintained. Coming to the personal front, as healthcare professionals, we are at greatest risk of acquiring infection. I don't need to highlight this topic because we are seeing it over on the news again. And so protecting ourselves becomes very important, because it is only if we are healthy can we help the community at large. Financial securities, those in private practice, those who are even working on salaried jobs, everybody has taken a cut. Everybody has, the footfall is reduced, so patients are not coming in. People have taken loans, they're on EMIs. So there are a whole lot of financial insecurities which are bothering professionals at this point of time. Stress and anxiety, of course, is all related. It's a vicious circle. One thing goes, the other thing has to follow. Well, the biggest fear that I feel, now this is completely a personal opinion, is if we get the infection is okay. But the biggest fear is taking the infection home. That is why most of the people, if you've seen in the initial part of it, and some people are even still maintaining it, healthcare professionals are keeping, either staying on in the hospitals or not coming back home as frequently as they used to. We are hearing of cases where parents have not seen their young infants for months together because they feel that the infection will pass on to them. So this is, notwithstanding, our biggest fear is taking our infection home and passing it on to people who are more vulnerable at home. So, well, we'll take one point at a time. Fear of acquiring the infection, acquiring the infection. Of course, this is something that all of us are aware of. PPE kits. The drawback is initially, especially when you wear it initially, it is extremely, you feel suffocated. Some people are claustrophobic. It takes a lot of time to get used to it. But this is something that there is, if you are handling the patient and you are in acute care, you are touching the patient, that this is something that you cannot do away with. This is something that you have to get used to. So also a lot of times when, especially when you're dealing with children, when they see this person in a space suit, sometimes it fascinates them, sometimes they get scared because there is no contact anymore. You can't see the person. And to have a visual of somebody who's treating you, or to have a visual is, I mean, or to see the person's face or to see the person's eyes is something that gives you a lot of comfort, especially if you are a patient. But now you're just seeing this person in a space suit and you can't see the person, you don't know what he looks like. That itself is very is a different experience for the patient and could be very scary for a child. So what is the solution to this? One is that when you are dealing with patients for the first time, especially maybe in a private setup, you could establish a one-to-one contact with the patient via a FaceTime, either on the computer or on the phone before the session, so that the person knows who he's talking to. If you've got an old patient, he knows how you look like, that's a different issue. But when you're dealing with new patients, a visual needs to be there. It's best that you establish a one-to-one contact over virtual media before you actually go into, so that when the person sees you, they know, they have a visual of whom they're possibly looking at. Maintain a strict appointment timings. This is it shouldn't be. In our Indian society, we're all actually 5 o'clock ka appointment diya hai. So yeah, if you're reaching at 6 o'clock and then the 6 o'clock patient is reaching at 5:45, and then there are two patients coming together. So this is again something that has to be done, that you need to maintain a strict appointment schedule. And if somebody is not arriving on time, then that person needs to be told that he is not going to be seen, because we don't want too many people sitting in the waiting room together. To be of course, again, this is possible only in a private setup. In government setups this becomes difficult, I understand that, but as far as possible, try and maintain a strict appointment schedule and ensure that it's not like chalega, ठीक है, अब बैठ जाओ, हम देख लेंगे. नहीं, they have, because that this is something that they might do again. Of course, it's easier said than done, but this is something that if we keep in the back of our mind, that is, we will be able to share, pass it on to our patients. Personal contact only when absolutely essential. If you can have sessions through virtual media, if you can talk to them over the phone, that is the best solution. And maintain the social distancing norms, wear your mask. These are ways to protect yourself. Frequent hand washing, regular sanitization of equipment and workspaces, people coming in, people going. These are tunnels where there are sanitizers. If you can do it, nothing like that. Otherwise, definitely make sure that you are not really coming in direct contact with the patient unless you yourself are protected. And of course, the patient has also taken adequate precautionary measures. This is something I'd like you to think about: cleaning versus disinfectant. Whenever we work in a setup, if something falls or something, we just take a cloth and we wipe it. Now that's just cleaning. But in this particular situation, it's not cleaning that we're looking at. It is much more than that, and that is disinfecting. So make sure that whatever staff is available to you, you insist that they're just not cleaning with water. They either disinfect with alcohol-based solution, or a sanitizer, or with soap and water, and make sure that the place is disinfected and not just cleaned. Financial securities, well, we can go on and go on about these, because definitely this is uppermost in a lot of our minds. We have families, we have we have commitments. If you're running companies, then we have salaries to pay people. So all these things are definitely integral, and we need to start dealing with them, addressing them. How do you do that? Well, we everybody has a different way. We come to a few solutions. The main concern here is not this. It is till when, how long. So this is the fear, the unknown, that you don't know till when this is going to continue. When is the vaccine going to come out? How, when are things going to normalize? So the main concern is that, when you have a deadline, when you have a time frame, you're able to find solutions. But when you don't have a time frame only, then your solutions also have to be catered accordingly. So what do? You list out your assets, your liabilities, you prioritize, do whatever you can by yourself so that you're minimizing personal contact, you're cutting costs. You must reach out to your old patients because a lot of them would be not coming to you anymore. So there's no harm in just picking up the phone and calling them and telling them that that you have started working again. You can give them sessions online. You can have virtual calls with them. Let them know that you are offering tele rehab services, and that you are available whenever they are ready to and also you must tell them that how it is important that therapy should not stop. It is just because they're not able to travel, because public transport again is a big challenge. People from the poorer backgrounds are not able to come because they don't have means of travel to come to your particular clinic. So reach out to your old patients, through your old patients to newer patients, offer them tele rehab services, and that's how you can reinvent yourself. This is again another point I'd like you to think about, is you may be going through a tough time financially, but so are your patients. So a lot of them have also lost their jobs. A lot of them have also taken salary cuts. Privately, if you think about therapy, a lot of, on a regular basis, maybe you're not going to be able to charge them as much. So be considerate, because it is in these trying times that all of us have to look out for each other. And believe me, your patients are having a tougher time, because not only do they have to take care of a person who is not well, they also have to take care of the other things also. So be considerate before you charge them. Maybe even offer free services to patients whom you feel cannot afford sessions, and do it properly, because these are trying times for everybody. And what you do today will definitely have an impact on things when everything becomes better. Stress and anxiety, I think if, we have been discussing in the past, the presentations also have discussed it. Stress and anxiety bound to happen for patients, for professionals. So the main thing is, we say in occupational therapy, if you have a routine, then 50% of your problems are solved. So maintain a routine. Go by, you may have one off day for yourself, but if you're used to getting up at a certain time, you're used to doing a certain amount of exercises before leaving for work, or you're used to having a breakfast, or you're used to going out for a run, please go ahead and do that. Have a routine for yourself, because a routine is what actually keeps you sane. So if you have a routine, then you have time for everybody. You have time for yourself, you have time for your family, you have time for your patients. Enroll in online courses. There are a whole lot of online courses going on. Maybe there is something that you've always wanted to do but never found the time to do. So it could be a cooking course, it could be a language course, it could be a professional upkeep course, such as a workshop that you've always wanted to attend but haven't found the time, or haven't been able to travel for that particular courses. Now most of the courses are online. So sitting in India, you are able to do a course which is being offered in the United States or in the UK. So make use of those online courses and do them. These are all things which will make you good about yourself, feel good about yourself, and also empower you with a certain amount of knowledge which you can use when this whole situation gets under control. Talk to people other than family and patients. So talk to your neighbor if they are, if ask them how they're feeling. Maintain your precautions, but talk to people. Talk to the milk person who comes, talk to the newspaper person who comes to you. I'm not saying don't follow safety routines, and we're talking about maintaining distances, and here we're just talking about having a normal conversation. looking at people is definitely, we are very social people. And if we are just talking to family and patients all the time, we need much more than that. Remember, in our workspaces, it's not just the patients whom we are dealing with, there are other professionals there. So we're also sitting down for lunch together, everything. Now, those things can't happen in these trying times. Those things have to be avoided. So at least picking up the phone, talking to them wherever we can, will certainly help. Most importantly, plan for the future. Don't lose hope. Don't feel that, okay, ab kya kare, why should we do something like this? This is it going to be of any use? Remember, if you have a plan for the future, you are going to work on it. If you're not going to work on it, then you're going to stagnate. Okay, so this is a picture that I've downloaded from the net, self-explanatory picture. If you, a small little plant, water it, take care of it, nurture it, is going to give you results. So what you do today about empowering yourself with various kinds of things is certainly going to affect your professional and personal skills, and which you're going to be able to use later when things become better, and things will certainly become better. Best way to avoid taking the infection home, we said the biggest fear is to carry our infection, is to work from home. Very challenging, no doubt, but if you can do it, then definitely work from home is the safest option. And you should try and do this as much as possible. Of course, I know it is not applicable to all setups, but definitely wherever possible, you could try to work from home. Safe practices, again, I'm just going to run through the slide because we're running short of time, and this is something that all of us know too well. We can do, somebody wakes up in the middle of the night, we can just rattle off these safety precautions. They're so ingrained into us right now. Keep up your immunity, eat well, rest well, be healthy. Academics. So a lot of students are now going on to conferences are being held online, classes are being held online. Of course, the challenge to this is there is a lack of hands-on experience, because the student learning requires a whole lot of patience and needs to make his mistakes. So that's not happening. So that definitely is a major challenge. And well, I know the academicians are working on it to try and see how they can manage to get that kind of experience to their students. And another thing which is suffering is research, because of course, research is something which is professional and required for your personal growth. So I have a very big respect for research. So a lot of challenges coming in for research is that there are dropouts. Patients are not coming to you anymore. Protocols were set before COVID hit us, and one is not now able to maintain those kind of protocols. Fewer patients are volunteering. So for those who have not yet taken up any research work, you all could think of working on instrument development, standardization of tools, doing surveys, developing a protocol or a model, reviewing papers. So all these little things sitting at home you all can do, and that is all going to help your professional growth, and with your professional growth will come personal growth as well. So though the future is unknown, but we need to look ahead, we need to plan for the future, and that's the only way where we can get up in the morning and say, okay, I have to get up, I have to do this because tomorrow is going to be better. So hope is what we are all now, we really need to not lose hope right now, and still stay extremely positive about what is going on. Make the best of the situation and stay positive for the future. You could think about doing a SWOT analysis to see what your strengths are, what the weaknesses are, what kind of opportunities and threats are you faced with today. So maybe doing a SWOT analysis at this point of time will also give you a guideline as to how do you proceed for the future. This thing is again very common. Change is the only constant. So the need of the hour, and I'm going to repeat it again and again, and this is the crux of my presentation, is to reinvent yourself. You need to reinvent, and that is the only way that you will be able to survive. reinvent, reinvent, reinvent yet again. So thank you so much, and that's all I have to offer. I don't know when the questions are going to come in, but if anybody would like to ask questions right now, or we have a session, I'm open to questions.
Thank you so much, ma'am. We'll again have a question round tomorrow together.
Okay.
So, yeah. So, very truly said, ma'am. Extraordinary times call for extraordinary measures. So, so like it's time, for always bear in mind that your own resolutions to succeed is more important than any other one thing. So I'm not the skin, I'm not this hair, I am the soul that lives within. Life is so much brighter when we focus on what truly matters. Well, today we have with us a multi talented skin specialist, Dr. Vikas Shankar. He is an assistant professor dermatology, Patna Medical College and Hospital, Patna. He is also a medical director of Shankar Skin Clinic, Patna. Sir will be throwing light on how to protect medical professionals from COVID 19 and general care of skin in COVID era. Sir, the show is all yours.
Thank you, Dr. Smita. It is my kind privilege to be with you all. I'm here not to speak, but to learn from you all. And I was listening all the previous talks, and I was really enlightened. And the live go on. So, may I share the screen?
Sure, sir.
So before I start, I must thank IAP WC Bihar chapter and all the executive member of IAP WC in Bihar for giving me this opportunity to participate in this COVICON 2020, especially Dr. Smita Singh, the organizing secretary, the chief patron Dr. Sanjeev Jha, patron Dr. N.K. Sinha, co-patron Dr. Vinay Pandey sir, uh, co-partner Dr. Uma Shankar Sinha sir, the organizing chairperson, Dr. Reena Srivastav, and all the executive as well as the organizing committee of this academic conference. So today's my topic is how to protect medical profession from COVID-19 and care your skin in the COVID era. So the aim of this session is to know how to protect ourselves, the medical professionals, how to make the clinic non-infective, skin manifestation due to the COVID-19 accessories, and skin care in COVID times. So the world has changed dramatically since the COVID-19 pandemic began. In addition to our social, occupational, and personal lives, the new coronavirus also poses a novel challenge for all the physicians, including dermatologists, physiotherapists, occupational therapists, and all medical professionals. Several skin conditions have emerged mainly as a result of prolonged contact with personal protective equipments and excessive personal hygiene. So how to protect ourselves, that is medical professionals, one, we should have mandatory in our day-to-day practice that daily temperature screening for all the doctors, including own self, all the staff, patient, relative, and all the medical representative visiting your clinic or hospitals. Because if you screen at this doorstep, you are going to screen the rising temperature, that is fever part. So you can screen out whether the patient is having active COVID-19 or not. So there is a stop on the doorstep. Physical distancing, another most important part, from the patient, from the relative, from the fellow colleagues. Sometimes we have a two or four fellow colleagues having the same room, either a meeting or consulting or something like that. So if we maintain a bit physical distancing, then we can have this slow contamination rate, and from the staff as well. So how to protect ourselves? By wearing this appropriate mask and this PPE kit. The component of PPE kits are goggles, face shields, mask, gloves, coverall, gowns with or without this aprons, and this head covers and shoe covers. The face shields and goggles through this contamination of mucous membrane of the eye, nose, and mouth is likely, and independently this touching the nose, mouth, eyes with a contaminated hand is another likely. The flexible frame of goggles, which provide a good seal with the skin of face covering the eye and the surrounding areas, and even the accommodating for already those people who are this prescription glasses already using this as spectacles. So to protect ourselves, another most important thing is nowadays is mask. If the both person is not using a mask, the transmission probability is very high. If one of the person is having mask and other is not having the mask, the transmission probability is low, but not minus. But if the both person is having this mask, wearing mask, the transmission probability is lowest. So mask is nowadays the greatest vaccine in the COVID era. So we are waiting for the vaccine, but the physical and true vaccine is nowadays is mask. The COVID-19 target mainly the upper and lower respiratory tract. Protecting the airways from the particulate matter generated by the droplet aerosol prevent the human infection. Contamination of the mucous membrane of the mouth and nose by infected droplets or through a contaminated hand also allow the virus to enter the host. Hence, the droplet precaution, airborne precaution using the mask are crucial while dealing with a suspect or confirmed cases of COVID-19. Performing aerosol generating procedure, masks are of different types. The types of masks to be used is related to the practical risk profile of the category of the personnel and his or her work. There are basically two types of masks which are recommended for various categories for the personnel working in hospital or community setting depending upon the environment, work environment in this COVID era. One is this triple layer surgical or medical mask, which you can see the green one, or N95 mask, either with or without respirators. So understanding the mask in what is the difference between different types of mask. If you see the cloth mask covering the face, basically it is a very loose fitting. When everybody, I think you have used the cloth mask, and after one or two sitting of using this cloth mask and washing, it goes very loose. So the this filtration level is very low in this cloth mask, and there is throughout leakage through the mask, cloth mask. And if you use this 3-ply, this surgical mask, sometimes it is loose fitting. If you have not single use, it is okay, but after double use is always loose fitted. So better and always discard after single use. It provides a moderate level of filtration, which has a medium or high density of filter layers. Now, there is one mask you can see in my hand. This is as similar as this white mask showing in the diagram. So it provides a high level of filtration, filter out at least 95% of large and small airborne particles. But remember, this is not N95 mask. This is KN95 mask. And sometimes it has this respirator. You can see the respirator, or it is without respirator. You can see both sides. It is not having any respirator. So there is high filtration rate, but the filtering the virus is very low in this case. So going to another chart. Now you can see the N95 mask. You can see this is a cup shaped N95 mask where you have the foam based protector and a pin in outside there, and this is a cup based N95 mask. This is the original N95 mask, and it gives around 95% of the virus protection, whereas surgical mask also give 95% when it is original surgical mask, and it must be used singly, never in the double times. Where this FFP1 mask also gives this 95% protection, but you have to check whether it is FFP1 one original mask or not. But sometimes you get an activated this mask, which only gives this carbon activated mask gives only virus 10% protection. Cloth mask 0%, and small this sponge mask also give a 0% protection. Now, how to test whether this mask is actual protective for us or not? You just blow air, and you feel through your palm whether the air is touching your palm or skin or not. If it is checking, is there any air pressure on the palm or hand, you consider that mask is actually not working, and you should not use that mask. So there is another type, those who are doing intervention either in the ICU or OT or someone else where you are very close to the mouth, or you are doing some aerosol procedure. Again, this you see this is elastometric half face piece respirator. It is also an N95 mask. You can see this mask. This is what this elastometric half face piece respirator. All the AIMS, I think this mask is very popular in the AIMS, in all AIMS all over India. And this is actually very protective. If you are using any, you doing any procedure which gives you fumes or aerosols, I think this is a very good mask, and you should choose this mask. Another mask is this elastometric, this full face face mask with respirator. You see in both these two masks there is external respirator. The advantage of this respirator is you can use this set of respirator for at least 30 days, and after 30 days you discard it. It is not, the whole setup is bit costly, not more than 2,500 rupees, but one set of this respirator costs only 500 rupees. So when you are very working in a very close setup of the COVID patient or suspected COVID patient, or you are not sure about it, so this mask is, I think, a wonderful mask and very safe mask. So this is also good. What is the advantage of this mask is, you can see there is a shield here, transparent, very hard shield here, and this will also protect you from the splash or the spit. So this is another wonderful mask, and you can use it. So can we use this N95 mask? What are the different methods so that sometimes we don't have in the early days is we have seen a lot of crisis in the mask availability also, and sometimes there is crisis, monetary crisis or availability crisis. So you can plan it whether you can reuse this N95 mask or not. Going through all the literatures and all the websites, so these are the few things what I got from the various portals. This is air drying the mask kill the virus, but it take at least 48 hours to dry. Before drying in the just air, drying for 72 hours, that means at least 3 days in one way of reusing the mask. So if you are just only air drying, keep it in the safe place of any corner where nobody is going there. Keep it at least for 3 days, and then you can use for air mask. But this is for those people who are not directly working on the aerosol area, or directly not working in the this COVID era or COVID wards. Because once it is contaminated, you are extensively using working in the COVID ward. Better you dispose all these mask and use it in the only single time. You can heat in an oven, heating around 70 degrees centigrade for at least 30 minutes. That kills the virus. Hang the mask in the oven by using this wooden clip. This work has been done by Stanford University team, USA. Dry it in the rice cooker. Put the N95 mask in a traditional electric rice cooker without putting any water inside for 3 minutes until the temperature is 149 to 164 degrees. Another is chemical sterilization for this H2O2. It is especially designed chamber for 45 minutes sterilization. Sterilize this filter without destroying it. and it takes a total duration of 4 hours. So attempt made for cleaning the mask with soap and water, I again say don't do this. It is not very scientific. Alcohol or bleach exposure or to ultraviolet radiation. Sometimes ultraviolet, if you can use it, you can do it, but not always. And again, I say if you are working in a COVID ward, don't do it. Radiation, isopropyl or microwaving all has been unsuccessfully as they damage the electrostatic charge and significantly reduce the filtration capacity. Suppose that you are not very frequently going to this COVID patient area, or like us as a dermatologist, we are just doing an OPD. You can put this N95 mask or any mask in an envelope for at least 7 days. You choose 7 masks. Right there is Monday in over the envelope, Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, Sunday, and use every alternate weekdays. So it can more than be 3 days or 72 hours. I think it will another. So this is either my proposal is either you use singly and discard the mask, or you use 7-day envelope formula. So the mask with the, this respirator, I'm talking about this part, respirator part. So it is a respiratory protective device designed to achieve a very close facial fit and a very efficient filtration of the airborne particles. But what exactly this N95 means? The N stands there for non-oil. It means it can be used if oil-based particulates are not present, and 95 means 95% efficiency to filter the airborne particulates, that is 95% protection. So here we know what exactly the N95 means. And the valve effect, this valve effect, the user of N95 mask may be find difficult to breathe sometimes, and some models come with an exhalation valve that can make breathing out easy and helps to reduce the heat build up inside the mask. But the mask with valve may not be able to prevent the spread of the COVID-19 as excellent air goes out without filtration. So it is safe for us, but not safe for the other nearby people. So mask work only when fitted appropriately, blow air, and if the air blow felt, that consider that mask a bad mask. Respirator only for this original N95 is allowed for performing this. I am talking this respirator N95 mask is this respirator N95 mask for performing this aerosol generating procedures. So again, when we talk about gloves, it is the simple latex gloves, white color or slight white creamy colors. But when we talk about gloves in COVID era, I think nitrile gloves are preferred over latex gloves because they resist this chemical, including certain disinfectants such as chlorine. There is a high rate of allergy to latex and contact allergy, which produces this contact allergic dermatitis among the healthcare workers. Nitrile gloves are not available everywhere, but latex can also be used. But when I'm talking about latex, you see, this is the latex glove. This is not obvious, not a very good quality, but it looks like this. So you ask for the latex gloves because it is a this allergic substance, and it will protect your skin. And where it is not available latex, you can use this nitrile gloves. I'm talking this, sorry, nitrile gloves. And where this nitrile gloves is not available, you can use jolly well use this latex gloves. But when it comes to the point whether you should powder gloves or non-powder gloves are preferred rather than powder gloves. So when we talk about this coveralls or gowns, it is the main component, or it is the base of this PPE kit, because this coverall provides a 360-degree protection and it is designed to cover the whole body. By using this appropriate protecting clothing, it is possible to create a barrier to eliminate this, or to reduce the contact and droplet exposure both known to transmit this COVID-19, thus protecting the healthcare worker in a close proximity within 1 meter of suspect or confirmed COVID-19 cases or their secretion. The coverall and gowns, they are deemed to actually acceptable as they are lack of comparative evidence to show whether one is more effective than other reducing the transmission. But I think coveralls are always better than gowns. When we talk about gowns, gowns means what is the this OT gowns with this cotton cloth, that green color, or this what gowns we use in HIV kit gowns. So I mean gowns is that, but this cover all is made with such material that there is no such permeability. So it is more protective and better option. Cover all also better option for those who are working in a proper COVID area. This apron, if you don't have anything, at least you have aprons. So you can use this apron, this white collar apron or any color apron, any protective clothing when you are using going out in patient things. Ladies with your this hair protection with hair caps, proper goggles, and proper gloves, and you should be at least covered by cloth, cotton clothes, or basically, at least if you are not using this coveralls and all. Shoe covers is also an important part of this PPE kit, as well as head cover, which is always attached to this coveralls. So can I use this PPE kit? Most PPE kit is designed to be used only one time. Few exceptional for some example, some types of this elastomeric respirator mask or protective eyewear such as goggles may be used reuse if the user follows the decontamination method in the product labeling. So all this products, these goggles, in their product box, there is a guideline how to decontaminate and reuse. Every product have its own method to decontaminate and reuse. So if you buy all these things, please do not throw the box and the leaflet inside it, because it gives a very valid guideline, because without that guideline, even you are using this or whatever the best equipments you have, if you are not following the guideline, it is useless. So please you be aware that even if the PPE is successfully, even if a PPE successfully protect you while it is being worn, if it is not it is not properly removed and not properly disposed with all the method which is follow the guideline, I think it is not PPE. No, disposable PPE is designed to be used only one time, and this by one person only. It cannot be washed. Washing PPE changes protectiveness and the barrier capabilities, and it may no longer be effective. But when we talk about, I am not dealing with the COVID era. So there is one option. So and this Baleno or this Maruti Suzuki car cover, that material is white material and very lightweight material, and it is impermeable to this ultraviolet light also, and it decreases at least 4 to 5 degree temperature, centigrade temperature, while it is covered with the glass. And DRDO also is using that very much material, is as similar as what DRDO is using in their PPE kit, and it is very lightweight. So you can have this kurta and pajama type of dress with long this full Chinese collar, with you can stitch it in a proper way with all elastic band here, just like a PPE kit. So if you are not working in a this COVID ward, and you just working in a private setup or a non-infectious area, I think it will work. But this is my own view. This is not very scientific, but what I have learned all these past 6 to 8 months, I am just sharing with you all. How to protect ourselves? Then again, regular hand sanitizing with soap and wash and 70% alcohol based sanitizer. I am coming to this hand sanitizing later. But very much important point is healthy and regular timely diet. That is very much important. You take a healthy and regular timely diet. Don't skip your diet, and don't undertake your diet, or even don't overtake the diet. Timely intake of the medicine, if you are taking any antihypertensive, anti-diabetic drug, or any other cardiac or any nephro drug or any other drug, you please timely take it. Don't hinder it or don't delay it, because if you delay it in this diet or drug, there is suppression in the immunity, and you may be caught by this virus. So this is another important point. Proper laundering of clothes is another important point, with no touch method. So when we go out for the day work, we wear all new washed clothes, but when we return back, don't try to touch the handle of the house or gate. Ask someone to open it. Just go to the bath, this washroom area, and put off your clothes. Put it in the either bucket with soap water, or indirectly in the washing machine. And you should not sit here and there and walk here and there. You should have a proper space for shoes to be put off, and another one slipper to be wear. Don't move barefoot there, and directly go to the this wash area. Wear off your clothes, put it in the bucket or in the washing machine. uh, just wash it there. Take a bath. The bath should not be very hot and not prolonged. Take at least soap water bath with minimum time, but with proper. Don't be in a hurry. Shampoo your hair if you are working in the COVID era. And this is the way where you can protect yourself as well as your family members. Protective covering of gadgets. Again, I have this, which is mobile. You see, I have this protective clothing. This I have bought from the Facebook ad. I think this is Eye Care company, and I think this is very good. I'm not promoting any company, but just for your help, because you see how it opens. Because when you are coming from hospital to home, mobile is such a thing that it is very vulnerable to your children and other family members, and this is the one of the way you can welcome the COVID virus. So you can just put it here inside this pouch and just lock it. After coming back, you have a soap water this wash with this cover, and again after washing, just put it out the mobile. Just spray alcohol based sanitizer over it, and you can use. I think this is one of the best method I have evaluated for me and for my family. If you don't have this cover, you can see this MSD photograph. This is only a plastic cover. You this is very easily jolly well available everywhere in the country. So just put it a sellotape there, or staple it over this. After coming to home, you wash it and throw out the plastic. This is a disposable method. Again, this is another. Another is this UV light sanitizer. I have this in my house, UV light sanitizer, but I don't believe. I believe only in soap water wash. Whatever we can wash with soap water, it is the best. Why it is the best? I'm coming in further few slides. But what the material you cannot wash it, like belt or watches, you can put it there, and be aware. I think it claims protection, but take do with precautions. So how to maintain the clinic as non-infective? The entrance management, either hand wash or foot manage alcohol-based hand sanitizer must be there, with shoe sanitizing tray. Reception area, again, you must have foot sanitizer, alcohol-based hand sanitizer. That means at the entry of that gate, doorstep, you have one sanitizing for hand, and one sanitizer for this shoe sanitizing tray. I have missed to write here one, that is the temperature screening method at the doorstep only. And the reception management, again, you need a foot manage alcohol based hand based sanitizer. In the chamber, use tabletop glass or fiber seal. This fiber seal. Uh, least this, you must have least wall hangings and other subjects, trophies and all books and all instrument in the chamber. At least your chamber must be vacated for at the end, when you end of your practice, at the end of the day, for this sanitizing spray and fumigation. Sitting lobby management, sitting arrangement as per the protocol distance. Floor disinfectant 1% sodium hypochlorite solution you can use. Instrument disinfectants are 1% sodium hypochlorite solution, 70% alcohol based solution, phenolic compound, soap wash, autoclave, or you can this activated glutaldehyde, that is Sidex. But while using this 1% sodium hypochlorite, be aware it is also a decolorizing agent, it is a bleaching agent. So when it's drop on your trousers or dress, it will decolorize it, and it is also an irritant. So when it come in contact with the skin, it will again cause irritant contact dermatitis. So mode of cleaning disinfectant, either you spray it. This sodium 1% hypochlorite is best for this COVID time. But remember, with this nickel polish or iron or steel, it will going to rust with this spray. But when you fumigate with 1% sodium hypochlorite, there is the area, the floor cleaning must be done by sodium hypochlorite. Even you spray the 70% alcohol based solution, this sanitizer over the sitting area, over the steel part or this iron part or nickel. So these are the photograph. In the first photograph you can see you can see the person is spraying, another is again spraying. This is a small sprayer. If you have a small setup, don't buy this expensive sprayer. You can use this. This is black satellite like fumigation. I have this in my clinic. This is very good. It costs around 25 to 30,000. And initially I was doing this spray method, and all my nickel coated this patient chair got rusted, and I painted it. But I got recently, I got this fumigation, and this is very good. As the last photograph, the small fumigator is there. The fumes come like this only in this also. It is very powerful and times saving, as well as though machine is a bit costly, is 30,000, but in long term it is very in the sitting area. You can have this foot base. You can see this foot base hand sanitizer model, or this temperature screening methods. In the, if you are large and very comfortable area, you can have some distance setting arrangement, or you can put the area in the chamber. You can have this glass or a fiber sealed while we talk to the patient. But sometimes we move out to see the patient, and as a physiotherapist or occupational therapist or as a physician, seldom we go and move the touch or take the blood pressure or palpate the lesion to diagnose accurately. So that are the other things, but you can do this facility in your clinic. This is the photograph again. This black one is the foot sanitizer, where you can sanitize the this shoe, and it is all available in the Amazon and all net. It is freely available. So you can use these methods for yourself, your patient relative, your remarks, and your family members. So now coming to the skin manifestation due to the COVID accessories, due to masks, spectacles, PPE kits. Although the specific skin changes due to the COVID-19 infection has not been described, and one could expect that iatrogenic secondary involvement of the skin, that is the hospital acquired secondary involvement of the skin lesions. Because disease with an epidermal barrier interruption could enhance the virus acquisition through an indirect contact. This dermatology patient might be at an increased risk for the developing infection. So skin is considered to be the largest organ of the body and the first line defense mechanism of the body. And there is disruption, interruption of the epidermal barrier. So there is more chance of getting infection, bacterial, fungal, as well as the COVID viral infection. So various skin condition emerging as a result of the prolonged use of PPE, This gears are pressure injury, contact each pressure area, exacerbation of the pre-existing skin diseases, including the seborrheic dermatitis and acne. These manifestations are mainly due to heat effect and contact reaction due to the prolonged wearing of this this PPE kit. So commonly reported skin problem among these healthcare professionals, irritation and skin maceration. These are the primary reason of the skin. While using mask, you can encounter this psoriatic area, contact dermatitis, itching, indentation. After returning from duty, you have this indentation mark over the skin, and this acne form eruption. Head caps, the protective the cap can be used scalp occlusion, leading to the itching, folliculitis, and exacerbation of the seborrheic dermatitis, because there is a lot of sweatings. So protective goggles may on the nasal bridge may gives you this continuous impression, and there may be laceration or redness or abrasion. The gloves may lead to form this blister or this sometime maceration or allergic contact dermatitis. Hand sanitizer with excessive and frequent use by using this detergent or disinfectant or alcohol based, any of these three effect actually this is derangement in the hydrolipid barrier, and this cause this dryness and irritation. So these are the few. This indentation, it is very clear in all these photographs. There is redness, there is abrasion, and there is contact dermatitis factors. So these are the one of the most common symptoms and signs for this mask and due to ill-fitted or very prolonged use of this mask and goggles. So these are the again either due to the hand sanitizers or gloves, this hand eczema with some blisters or allergic reactions you can see. Another thing, preventive measures, how we can prevent this during this COVID era with this PPE, accessories to avoid this skin irritation, erosion, maceration, and contact dermatitis due to this PPE kit or personal hygiene measures, excessive personal hygiene measures during this current pandemic. The application of good barrier cream, that is Vaseline petroleum jelly, it is the cheapest and best skin barrier. Before and after wearing the PPE kit around the face, lip, and hand. And it will come in between the PPE kit or gloves or other factors, the skin, the Vaseline petroleum jelly, and this PPE accessories. So it will prevent the side effect in a very low cost basis. And wearing a properly fitted mask, if you have ill-fitted mask, it will produce some side effect. But if you have a properly fitted mask, you can avoid this side effect. And if you use the face moisturizer before wearing this protective equipment, I think it will help to lubricate the skin and reduce the skin friction. For persistent itching and pruritus at the site of mask, put 2 or 3 layers of gauze. This N95 mask is having this foam base, but all masks don't have this foam base. So sometimes it's very hard and very pinching. So in that case, you can use some gauze piece, but not very thick one that will protect your skin. And always moisturize your lip with a good quality paraffin balm or a petroleum jelly before and after using this PPE kit. And as lip dryness can lead to cracking and proliferation of this bacteria, fungus, and virus also. For more oral mucosal care, always try to wash the mouth with normal saline or water when you are coming back from work to home. So always try to gargle your mouth with normal saline or just only tap water, so that all the other external factors may be washed out. For acne prone skin, it is always advised to use moisturizer which do not contain oil. There is another product, a special product for acne form skin, is non-comedogenic moisturizer. It is clearly written in the moisturizer, it is non-comedogenic. All moisturizer which is non-fragrance, non-colored, and non-comedogenic, I think it is the best moisturizer. Whichever company which claims it is non-comedogenic, non-fragrance, and non-color, you buy it. A single layer of high quality latex glove is sufficient to protect So those people who are prone to contact dermatitis with latex glove, and this uh, another quality gloves is not available in the market or nearby shop, you can use simple Vaseline petrolatum jelly. Again, what I told earlier is there is skin Vaseline petrolatum jelly and there is latex gloves. So the in between the gloves and skin there is Vaseline petrolatum jelly. But you can also use this cotton inside gloves and then you wear, but practically it is very clumsy and not possible. Apply a good hand cream regularly and avoid wearing gloves for a long time. Use a cotton gloves, what I just told you. Inside a latex glove would help to protect against itching and irritation. Using these cotton gloves, that again a good point in favor of cotton gloves is it absorbs the sweat and moisture. So that is, but practically it is not possible. Use sanitizer containing ethanol as the main component of hand sanitizer. Keep your hair short, not possible in females, but in males you can do it. And try to cover hair completely with surgical cap. Wash hair first before taking bath shower, because if the hair is contaminated and you wash your body and then you wash your hair, again the contaminated part will come to the body. So wash your hair first and then take a body shower, and avoid the overheated water. If hair is not contaminated, then try to use normal ordinary shampoo or avoid strong chemicals. You can use this Syndate bar which having this 5.5 pH. Avoid excessive sweating as it tends to damage the skin barrier, and it can be controlled by avoiding this prolonged working hours, taking a proper shower after leaving the contaminated area. Avoid shower with over hot waters and apply moisturizer just after shower. That is very important. Frequent showering features lead to loss of lipid this leads to surface lipid removal and subsequent loss of certain corneum that may lead to scaling, itching, and dryness. So strictly avoid touching the periorbital areas, region, and including the perioral area also. So that will give you a strict protocol you must follow. Do not touch around the eye and around the mouth. And if these skin conditions persist or worsen gradually, it is necessary to visit a skin specialist. So what's in the soap? Now the question is whether soap is important or good, or this alcohol based sanitizer is good. So one thing is there is a proper method of applying soap. You just rub it, then in between the fingers, then from behind both sides, and then the thumb area, and then the nails area, and then again you follow this area, and it must be at least for 20 seconds. And if you're not going to count or see the watch, you just say happy birthday to you, happy birthday to you 2 to 3 times. It will cover the 20 seconds. So this is the way how you do the thing. Then again, how the soap work. Actually, you see this spike which helps this virus to enter the cell. But you see the golden part, the yellow golden part. It is made of this coronavirus is made of lipid membrane and other proteins. Now, suppose you have an butter, this butter over your palm and hand, and you want to just wash it with your plain tap water or even hot water. You're not going to get rid of this chip-chipapan. So when you wash it with soap, your hand is washed and this butter part is gone. It is just like this. The outer covering of the cell membrane of this coronavirus is made of phospholipids, and this lipid membrane, when you apply this soap, it's destroy the outer membrane, and the whole structure of the outer membrane is COVID virus is destroyed, and there is death of the virus. So this is what I want to say here is, whatever you want to do, you just wash your hand, and it is the best practice. Now, either hand sanitizer is non-alcoholic or alcoholic base. But this alcoholic base, and whether it contains 60 to 95% alcohol, and it contains ethanol, isopropyl alcohol, or N-propanolol. It is an effective way of killing the germ when compared to non-alcoholic hand sanitizer, and it is flammable. Whereas this contain this ammonium compound quantity and such as benja alkalium chloride instead of alcohol. It is this non-alcoholic sanitizer is not good. So this disinfectant, this ethanol gives with concentration of 95% with effective exposure give 30 seconds. Ethanol of 70% with effective exposure is 10 minutes. This isopropyl alcohol 95% concentration we need with effective exposure of this 30 seconds. So with this chart, this hydrogen peroxide 0.5% concentration, but effective exposure you need 1 minute. But we see, okay, company has written this 70% alcohol. I think below 70% is not going to work in coronavirus. So whenever you're going to buy the sanitizer, check for it whether it's contained in 70% or not. But how to check practically whether it is 70% or not? You just pour it on the palm and just have a spread on the both palm, rub it and just dry it. If you feel extreme cold, it is containing 70 or more than 70%. That is the only way practically you can check. But if it is not going to give you a complete coolness of the palm and hand, that means your sanitizer is not alcoholic based. The concentration is less than even 60% and it is not going to work. So that is the thing with this hand sanitizer. So soap as sanitizer, soap has always a better killing capacity. You prefer soap. With time to time, try to wash your hand with soap with a full lather and foaming, and wash it for 20 seconds. It is always, but when there is not availability of this basin and water facility and soap, you cannot wash hand, then in that condition with time to time you can sanitize your hand and the skin with at least 70% alcohol based sanitizer. And now coming to this is COVID-19 getting inside your skin. So you all are, and we are all professional, and sometimes doing this physiotherapy, you come across the skin lesions. Oh, what is this? So in COVID area, be alert. If you having this maculopapular erythematous, this exanthem rash, or rash with chicken pox, like chicken pox means the classical lesion of chicken pox described is a dewdrop on rose petals. So एक गुलाब के ऊपर के एक गुलाब के पंखुड़ी के ऊपर एक ओस का दाना, that is the actual definition of the characteristic this chickenpox lesion. So when you see this type of lesion or livedoid reticularis, this network like pattern of erythema and this purpuric lesion, or the swelling and redness of the toes, either this foot toes or hand fingers toes, be aware it may be a case of COVID patients. These are the few skin manifestations which we have come across in recent past 6 to 8 months. So be alert. If you are going to see the rash, ask your patient to consult a dermatologist and ask for the history of fever. If the history of fever with these lesions, this could be a patient of this COVID-19. Again, this livedo reticularis, maybe some vasculitic lesion, or this acral pernio, the swelling and finger and of toes, versiform exanthem, or petechial or purpuric lesion, or articarial this eruption. Those signs are not very specific for COVID-19, but you may rule out and you may screen out a few patients. So what are the skin care in COVID-19? Hand care with be gentle to your hand. Avoid any antibacterial cleansers. Now there is an ad. There's a boy going to market with grandmother and to pick up this 10 rupees note. He went inside this garbage of this fruits. Or there is another ad from the same company. Boy is going to play football in the mud, and they are claiming this 99.9% germ free with that soap. I'm not going to take the name, but you can understand the thing. But try to learn. This medicated soap is going to harm in the way the outer layer of the skin, this epidermis, is layered with the normal bacterial flora of the skin, and that is the first line defense mechanism of the skin. And when the external agent, this antigen or any microbe are coming to it, these microbes are electronically charged and they repels out the other microbes and antigen. But when there is 99.9% this germ normal bacterial flora of the skin is lost, now the allergy and infection will more come to your body and skin. So be aware with this this antibacterial or medicated soap, whichever company, whatever they claim, it should not be used in the regular practice, and they aren't be useful for preventing infection disease. They are all contain chemical and fragrance and can irritate the skin. Wear gloves while when cleansing or protecting your skins. This moisturizer, it may be hypoallergenic, fragrance free, color free, and I think it is the best. And 1 ton is non-comedogenics. Don't ignore your skin protection. Be watchful during this COVID era. Facial care, adopt a regular skin care practice. Choose a product which is non-comedogenic for your face, especially in the acne-prone skin. Don't use product with petrolatum that may be occlusive and may cause this occlusive folliculitis. Use your barrier ointment or bandage or this ease blister. And if the blister form, keep it clean and apply antibiotic ointment and use bandage to create a protective barrier between the blister and the mask or any other thing. That I think is enough. And treat acne. And if you have severe skin problem, please contact skin specialist. So to conclude my talk, skin is the first line defense mechanism. That barrier against different types infection and integrity is lost due to the various external factor. In the current global circumstances, the potential incidence of such adverse dermatological effect does not in any manner causes the healthcare professionals and our general population deviating from the strict specific precautionary hygiene rules.
Sorry to interrupt you, sir. With interest of time, we would like to, if you can
The
just...
skin problem are manageable with the few mentioned precautionary measures. Special attention should be taken as per the choosing the proper mask or sanitizing equipments as per the need and exposure level. COVID, the threat is unavoidable but predictable. So let's place to have the precaution to this precaution at unmistakable. So we are still learning COVID-19. For any assistance, thank you. Thank you all.
Thank you so much, sir. It was very informative session. Well, your brain has more than 100 billion cells, each connected to at least 20,000 other cells. The possible combinations are greater than the number of molecules in the known universe. Today we have our Guruji, my Guruji, Dr. Narkish Armugam sir, HOD Department of Physiotherapy, Punjabi University, tickling the cortex. Yes, sir, cortex is tickling, isn't
Right.
it?
So my voice is audible?
Yes, sir.
Right. I'm going to start the class because we have this limited time. So that start from initial. My voice is clear?
Yes, sir.
Clear, right? I can go ahead further. Right. So thank you very much, Smita. After a long time, I have the wonderful kid students. Today, I'm trying to be a teacher like these people. So let's come to the straight away to the class because we have 30 minutes. I have to give some tickling of cortex to everyone. The past almost 20 years of education after the PPT, MPT, PhD, osteopathy for 3-4 years, then chiropractic. Then I come to know when you want to recovery of the neurological patient, you have to improve its function of the damaged cell, not undamaged limb movement. Like most of the in India, what we are doing at present maximum, we are depend on like passive movement, stimulation. These are the two most important word we get in this work. So let's start direct away. So what I'm going to talk about, I'm talking about the tickling of cortex, functional and electrical of the brain. And at present, I'm in Punjab University, Patiala. I'm working as a clinician, research, and a teacher. I'm trying because without student, there is no teacher can be possible. So I can't teach anybody anything. I can only make them to think. It's a Socrates. So today I have only 30 minutes to tickling your cortex, nothing in my mind. Just to see this picture itself, it is explained very well. The past many decades, there is a lot of change in electronics technology, but not in our treatment protocol. Because maybe we are candle, we are not accepting the bulbs. So let's see where we are today. So let's 22 evidences that confirm we are living in the future, right? Translating lens. Immediately translate without anything. Yes, sir. Yes, sir. Sir. Sir, 30 minutes तक available. Sure, no problem. Okay, okay, thank you, sir. Sure. So we have come up. This is a lot of evidences. There is a lot of research changes. So let's go further. We have a lot of one. So this video I'm going to show you in 2019. There is the Stanford University of Auckland, and Nissim Tessin. The four institutes done a world-best research that indicate yes, brain had its mobility. In past few of in Indian physios, they are not accepting. There is not me. I'm not going to say this. This is 2019 innovation by Stanford University. Let's see these evidences. Hello. So you can come to know the brain has movement. Now we are the word. So we should come out. The 100 years before, more than 150 years before, Sunderland, who talk about the different classification of nerve, we accepted, physios are accepted, and medical science may not accept it. Now medical science said, yes, there is an amplified MRI find out, there is a motility of the brain. Mobility means the brain get movement, motility means each and every cell. In 2017 Nobel Prize for that, each and every cell had its movement. So we have to come out from the box. That's So we have 5 phenomena in the body. One is there is an inherent mobility of the brain and spinal cord. The fluctuation of CS of history of intracranial membrane is true. Articular movement of the cranial bones with the minor mild motion because of the inside movement, it always reflects on outside, and involuntary motion between the cranium, sacrum, and ilium. It's a true one. So you see this is called motility and mobility. Inside of the tissue, movement is called motility. So what happened? In the globe, when you roam around in the sun, that is called mobility. If cell spinning motion is called motility. So each and every cell, the part of mobility and motility of the one, it maintain a healthy status. The primary respiratory mechanism is explained by Sunderland in more than 50 years. It starts from the birth and finish at the death. So now the time we have to open the mind and find out the interdisciplinary research one. So I'm going to show you the movement by the cranial rhythm. So it's a superior view. Right mind movement, which produce the movement of the one. So here we are. So I know I have backside some of the noise because of the clinic is going on. I'm not in the home. I'm sitting in the hospital, closing the door and taking the classes. That's why I'm sorry. It's very difficult to carry in the hospital with the running. So now we have this. So we have the body rhythms. Not only this, brain, heart, 72 pulse per minute, respiratory, 14 to 16 to 18 per minute, cranial, 8 to 12 beats per area, even alpha. Cranial rhythm of alpha is 8 to 12. Visceral, 4 rhythm. So it is maximum close to our respiratory mechanism. So what do you want to say? Yes, brain had mobility and motility. If mobility is affected, there will be a symptomatic like behavior changes, learning problem, language problem, writing skill and spelling problem, maturation problem, all I say. So we have come to the one. So what is a craniosacral therapy or a clinical osteopathy? The birth start from the subluxation. John Pleasure in 1975 talk about the cranial system, and usually take 25-30 minutes, not much time of working. There will be a whole body. You can see there is a ventricular system, spinal system, and all is semi-movable movement. It's respirated. Even the last time I took a class in one of the big platform of South and Central, one physio is not accepting. There's no movement at that area. I said, it's not I'm going to say. The world say, you have to accept. The US regulating, WHO identified. So what I'm a single person, I say it's wrong. The Sunderland, we are studying the classification. We are talking about the no functions. We are talking about the sliding mechanism. But please, this is a time, whether you are accepting or not, it's true, it's going to exist more than 150 years. So if it is a trauma, if a chemical, whatever the injury, it reflects the area. It maintains the mobility and motility of work, and it has developed very smooth observation of CSF will work. Palpation is matter, 6 to 12 beats. This is the position of the hold of vault. What is my head? You hear this. This is the finger where the greater wing. Sphenoid bone is the generator. The greater wing is the most palpated. So there is a basic movement is flexion and extension of the vault. So flexion and extension, single bone and dual bone. We will see in the later stages. This we can feel the motion of the one. So yaad rakhle, whatever happened, if a headache, people tie up this. Why? They're stopping the mobility. That response. So now the scientific researchers also say, if you're pressing, using helmet, all can restrict it and change the frequency of one. The frontal bone, this is called mectopic switcher. This is can be lift. Yes, give wonderful behavior change abnormally, different lifting and alternative method of lifting. Come to this, one portion is mobility, another one is physiology. We are going to stimulate the brain tissue. The before that is a mobility and motility. Now a damaged cell can be stimulated, that only sprout. If you imagine it, everybody call plasticity, plasticity, plasticity. How it is possible? When the patient is participate. So how to participate? There is no motion. So stimulate the cell itself, creating a plasticity. So just to watch. This is a small machine. We have the multi-channel. She is the patient with the stimulation. You see the heart paralysis, not even to find out how much is performing the gross motor activity. So now the summate, voluntary activation and potentially changes without increased blood supply. The most importantly, this stimulation not increase the blood supply. So what are the indications? Brain trauma, stroke, spinal injury, whether it is a trauma, traumatic, metabolic, anything can use without increasing the blood supply. Even tumor can use it. Wow, what a wonderful innovation. It's called TDCS, transcranial direct current stimulation. We did more than 2 PhDs and funded by central government. We are running the high level research on multi-channel. Now we are with the multi-channel. You can use loop theory system can activate it. Right, come to this one. This is sprouting. How it is possible? Plasticity is only possible when there is an involvement. Involvement is how possible? Initiating of the motion. This worked very well. So we have the another video. Sorry. Yes, we are rewiring the brain. That is possible. Rewiring the brain is possible when we have the technology. What are the principle in this? These are 10 principles everybody know. This principle is only possible when use it or lose it. The person in the coma, the person is not able to do any motion. How you get? The motion is only possible by when you want to perform. So what do you want to say? That's it's a TDCS is the future. We can get much changes. So we have this plasticity, two type structural as well as functional. The both plasticity is possibly gained by TDCS. So now we say
your brain is an important and powerful. mind-bending puzzle. Challenges are not easy, and we often lose when we try them. Your billions of called neurons. Your neurons are what grow. More your neurons can grow. Challenges are kind if you stick with them. With enough challenges. Challenges are opportunities for growth.
Right, you are become more stronger. So this is the scenario of India. We are using CMT, mirror therapy, boba, movement therapy, sensory integration, task oriented. You just see what we are still stretching. We are still stretching, which is contraindication to a stroke patient. And we are making abnormal flexor synergy. And you see, there is a method of approaching friend is the problem. His right arm, you see how he is holding. What about this guy is doing? These are all photographs taken from these different centers. So this it is. Rehabilitation always helps, but we need better in further. Most of the therapists said, "Yeah, मैं patient को walk करवा दिया, बहुत काम करते नहीं." How you make it better way? That's it. What about this technology? Multitask in surface platform back to the normal life. The second one is this is called RTMS, repeated brain stimulation, ritual system and rehabilitation, participant with the ranges. So what happened? Why? The single word said India is a developing country, we don't have this. So we give exercise, but we are the wonderful inventor. Jugaad. Basically we
कितना
use
अच्छा
jugaad.
है, पता बीच में कट जा रहा है मेरा भी, फिर बाद में देखेंगे इनको। हाँ
Right. Somebody's rice kar lete. So a study, one of the study is done in our place. We are across the therapist what the strategies used by therapist. You see 50% of therapists said I'm using electrical stimulation. There is a strong evidence that electrical stimulation will never give plasticity without any participation. Strengthening the hemiplegia patient is need facilitated motion, balance and coordination. You hear still I can say 35% of people is using passive movement. So we have some views. This is called SIBO system. It is a not orthotics which is can give a movement. So just to see this video, you can find out. We are using whatever you are getting is using now. So this is the most common problem we are facing with the stroke patient. We can't hook it. That's a big problem. Now you see with the SIBO glove, we can transfer wonderfully the fine motion of fingers. It's available. This you should use in a better way. Now we have this another video. I'm with the evidences. I'm giving all are with the evidences we are providing here. So you see here. This is a more chronic cases and tight structure. This is called SIBO flex. He can work with his hand grip and functioning. Then you see there is the movement is called hand functional. This is called SIBO stretch, SIBO flex, SIBO glove, SIBO stretch. Three method can get a multiple work to happening. Yes, this is functional electrical stimulation. What is the difference? The functional electrical stimulation depend upon patient energy and participation, not passive. So if you have the muscle work 10%, the 90% of work can produce by electrical stimulation. It can assist, not passive. That's why the functional electrical stimulation. Strong evidence is available. That is 2017 also evidences. Come to this one, TDCS, one of the best method I'm using. I'm getting amazing result in cognitive deficit, spelling problem, dystonia. These all speech problem, hearing central problem. So we have the another video because of Right. There is no side effect. That's the most important. It's a 2 milliampere. Don't use your stimulator. It had a specific one. It is a 2 milliampere DC current. Please don't try in everything. This one, only one Indian company is made that's called Walnut. It is costing just 40 to 50,000 rupees only. Multi-channel is a little bit costly, but this machine in international market is a huge cost. So we have this one. So come to the point, how it does work for a hemiplegia especially. Right and left hemisphere, you see, right and left, the person had paralysis. एक तरफ का paralysis हो गया. What happened? The opposite side limb get lower functions. So what about unaffected get hyperaction? So now we need to interhemispheric model. How to do? I have to inhibit the stronger hemisphere first, then followed by stimulation of affected hemisphere. That's why we can get interhemispheric model, get better response. So now you can understand TDCS is the future. It's a unipole stimulation, cathode anode activation inhibitory. There is a lot of work. The measurement method as well as very simple by EEG method we are using. List of condition you see, there is a lot of cases you see. You see here, attention, verbal expression, motor planning, working behavior, vertebral memories, vertebral understanding, sensoromotor, spelling problem, critical, incontinence, visual problem, cognitive process, and emotional memory. So you see the all different problem can be rectified by TDCS. So what is this? This is called repeated magnetic stimulation. It's a deeper than costly, a little bit costly. We use very recently research is coming up with wonderful research. I have some, you just listen it.
A region of the brain involved in repeatedly each time
Wow, this it's a deeper, like Parkinson disease, we can stimulate it. So here, this is called a cranial stimulation. TDS is different, RTMS is different, and cranial. This is for psychosomatic, fibromyalgia, everything. You just see the mission we have in my clinics. So there is a called based GSR EEG. So just to make the person is lie down, plug it into this area, improve the sleep, remove the negative thoughts, and amazingly walk. There will be a no side effect to work one. So now virtual reality. Yes, there is a participation virtual reality is the future. Robotic assistant, yes, it will come in future very soon. Very less prices we are working. The computer interface, the impulses take from your brain by the EEG, then analysis software and translate into visual reaction with VR or the CPM. So we can get response from the area so that the network of the brain gets sprout and get plasticity. And advantages, what are the things advantages of what it's basically what I want to say? Greater constant therapy, home use, never tiring, highly motivated patient, optimist patient support, precise and recovery is measure, labor and cost saving. Amazingly, we are working and we are growing very fast with this work. Evidences. Yes, there is a neuroplasticity changes rehabilitation with the regional electrical field by TDCS, published elsewhere in a neuroimage. And the TDCS work with the primary motor cortex is proved. Then it is a involuntary motion is controlled. Task-oriented stimulation get better one. Aphasia, speech can get better, and behavior evidences can be corrected. And schizophrenia can get the most important, a systematic review on reporting assessment of adverse effect, TDCS nil. That is except skin changes if it is rare, otherwise no. This is non-invasive brain stimulation study. So you can see amazingly to work. So there's a time we have to think. Treat the damaged part, treat the cause, not a symptom. So this is a time. Take home message because I want to finish it in 30 minutes. I have another 6 minutes also. Neuroplasticity provides us with the brain that can adopt not only the changes inflicted damage, allow the adapt to any and all experience changes may be encountered. Early intervention to be a best one. Neuro enhancement and based on electrical intervention among to be a task-oriented training going to be a number one and in the world. Imagination is the beginning of creation. You are imagining what you deserve. You will what you imagine. At last, you will create what you will. The basically socho, sapno, impatience, creativity. Each and every patient is mine. I give recovery. This all creating this thing outside of the box. Now we are giving a wonderful recovery in this area. So your ability to heal come from knowing. Please study well, lead more, and take up of more initiatives. Don't wait for opportunity. Create it. This is funded by Government of India because I have to give the thanks to them. It is 54.6 lakhs funding of this research from SCRB, Science Engineering Research Board. Now we have completed this project. We are going for multi-channel now. So these are the references. Grow every day brain. So we cannot say, fine, education is not learning the fact, but training the mind to think. So today, in the 30 minutes, thanks to IAP, especially Women's Cell, they are giving me, once again, never give up. Never give up. Almost to more than 2 decades of one, I'm developing myself. I'm studying myself. So I wait for creating. So just you see this picture, the team work together. That is one. Second one is right side you are seeing that is a Kanyakumari where I was born. Basically, you see that is sunrise is a famous. But still the sunrise you are seeing what is one. Now you see with electricity. The master is how you see yourself. With electricity, you see what a beautiful view. The electricity make you smarter, work greater, look good. And thanks to my university, Punjabi University, where I work, presently work, but lot of memories I'm carrying from SBS, PGA, Dehradun. Yes, lot of memories. Still living with that memory. I'm working ahead with a lot of blessing and care of my students. And they are made, they are the stones today I'm standing. So each and every part of my life they have. The strong people do not put others down, they lift them up. Thank you very much giving opportunity for sharing my time and you to learn and everything. Anybody can have any queries through either email, WhatsApp, anything you can work. Tell me, what can I help you? So, Zoom. Yes, ma'am. I think so. Finish. Stop sharing.
Yes.
Tell me, Smita.
Thank you so much, sir. Thank you so much for such an informative session, a weighted session, sir. So
It
I
is a
know you're
pleasure
very,
to.
very busy.
So I think I'm not rushed because of I tried to finish in 30 minutes because of already schedule is going late so that I can finish it fast.
You'll have to come again, sir.
Anytime, always you always.
So, so we'll move further ahead. Scientific truth is universal because it is only discovered by the human brain and not made by it, as art is. The human brain is the last and greatest scientific frontier of all time.
Sorry, Smita ma'am, we lost your voice. We can't hear.
She is a guest speaker, Dr. Donna B. Brainbridge. She is PT EDD at our team. Well, she is a Special Olympic Global Advisor for Fun Fitness, Chair World Physical Therapy Network on Intellectual and Development Disabilities, Adjunct Clinical Professor, University of Montana College of Health, Professions and Biomechanical Science, Consultant, University of Montana Rural Institute on Inclusive Communities. She believes life isn't meant to be easy, it's meant to be lived. Sometimes happy, other times rough, but every up and down you learn lessons that make you strong. She says, I won't change you for the world, but I would change the world for you. And she has done that. She also says the best gift you can give a child with special needs is your friendship, to include them, play with them, and believe in them. She is a lady who has devoted her life for special kids. I will not waste your single second, ma'am. So sorry, ma'am. I made you get up early in the morning. Ma'am, please come up.
I'm here. Can everyone hear me?
Yes, ma'am.
And do you see my screen?
Yes, ma'am.
Okay. It's amazing always when this works. I want to thank you all for inviting me to speak. This is a great honor for me. I've known Smita for a long time, and I'm just delighted to be able to do this for her. We'll take a little bit different path this morning. Several of you have alluded to understanding and learning for people about COVID and what they should do. So what I thought I would do this morning is discuss a little bit about what Special Olympics developed and the strategies that they followed during COVID-19 for people with intellectual disability and for their support systems. I would like to say before I begin that even though we're addressing what we did for intellectual disability, a lot of these materials can be used for people with any type of cognitive impairment. So if you have other people who are older with initial stages of dementia or lack of understanding, I think many of these tools will be able to be used for them as well. I put a lot of links into this presentation so that you will have a lot of ability to go to these links and review the materials for your use. All right. So let's first look at the impact of COVID-19 on persons with intellectual disability. The mortality rates for COVID-19 in people between 18 and 74 years of age is about 2.7% for those without ID, but it rises to 4.5% for people with intellectual disability. Patients under the age of 18 with intellectual disability are more likely to die from COVID-19 than their peers. Very few deaths have been documented under the age of 18 for people without ID, but it's 1.6% for people with ID. The mortality rates, however, are similar for those over 75 years of age, about 25%. We do not know how much more likely people with IT are to be infected or how they become infected because there's been very little surveillance in this group. Why, therefore, do these individuals have higher rates of vulnerability to COVID-19? This is the group that are more likely to have other disorders, be they nutritional, endocrine, and metabolic, or cardiac and circulatory. They also have less access to quality health care for their chronic conditions in, I would say, all parts of the world. They have a lot of chronic conditions like diabetes, asthma, obesity, heart and lung disease, and therefore they're more at risk because of these, and they have had less access to quality health care for these conditions, which puts them even at greater risk. In many parts of the world, there's not a lot of good medical provider education about the issues of people with ID. And that's true even in our country. We're mounting great educational programs, both in the US and globally, to try to train practitioners to be more astute about the issues that our population faces. But this is an ongoing problem. They have to rely on caregivers for their daily life support. In the US, a lot of them live in community-based settings, but they still have caregivers who either live with them or come in and help them support their daily life. So they have to rely on these caregivers for daily support. Many of them live in congregate settings like group homes. So they're going to be in a setting where they have a group of people and they're going to be at a little bit higher risk because they're living within a group. They have limitations in cognition, language, and understanding, which is going to make them more vulnerable because they may not understand why they should be using masks. The additional effects of isolation with people with ID, many of them are in educational programs now that school has started again that's specialized, and they have specialized interventions and educational plans. So there's a large question of whether this will be possible in terms of the schools reopening. They have a lot of difficulty verbalizing their symptoms and their concerns. So if you're doing telehealth with them or talking with them on the phone or through the computer, it's not always easy for them to tell you what they're worried about, what their concerns are, and what their symptoms may be. Isolation can cause stress for them and can trigger some of their problem behaviors. Anxiety over coronavirus and obsessive concern with it can also create problems with behaviors. Their usual routines, which a lot of them really flourish because they have routines. And one of the other speakers this morning talked about the importance of having routines. But with this group, they may have a breakdown of these routines, and that will lead to more stress, more anxiety, and more behavioral problems. They have not as much access as the general public even to personal protective equipment like masks. And their access is going to depend on their support system. So it will depend on how efficiently those support systems can get them protective equipment. And because of their cognitive problems, they may not understand as clearly the issues of social distancing, hand washing, and mask wearing. So when faced with all these issues, and with a huge population of athletes that we engage with, we have over 5.5 million athletes who are members of Special Olympics, we started strategizing about how we could deal with this best for these athletes. And so we came up with 6 strategies, which I'm going to talk about, to try to deal with this for our athletes. Our first strategy was cessation of all events. So in order to protect our athletes, all sports trainings, competitions, and events of any kind were canceled in March of this year. They were initially canceled at least through June, and that is extended out till August. We have just very slowly begun having some events in September. We created a page on our website with frequently asked questions about COVID-19, and this was created for athletes, their families, and their caregivers. We also created a 30-minute e-learning course for the entire Special Olympics community on COVID-19. And I put the link up there. We have an e-learning site now, and you can go to that link and register and actually take that 30-minute e-learning course yourselves if you're interested. Our second strategy was education. And I think that everyone agrees that education and learning what to do and why to do it is critical for everyone, but specifically for people with cognitive impairments. So we developed a video for healthcare providers on how to manage people with ID properly. That link is there. We did a graphic and a video on proper hand washing for athletes and their caregivers to use. We also created a graphic on how to wear a mask. And we created stay-at-home activities with social distancing for children, knowing that parents were going to be in their homes with children. So we tried to create a stay-at-home activities site for them to give them some ideas of things they could do with their children and keep them occupied. Strategy 3 was to keep them in good physical health. So we've done a lot of different things that will be fun for you to look at. With the WWE, I don't know if you're familiar with the WWE wrestling group. They worked with us and created the Special Olympics School of Strength. And that has videos that the athletes can progressively work through online to maintain their strength and flexibility. We have a fitness group over here called Anytime Fitness, and they run health clubs. And so they have been a partner of ours, and they created live workouts for the athletes so that the athletes can weekly go online and do these workouts with the people from Anytime Fitness. We also created a Staying Fit at Home bingo board so that they can use this bingo board and they can go in there and check boxes when they accomplish things on the bingo board. Pandora Radio created a champions playlist, which is a list of music that they can exercise to. They can go on this playlist and put on some music and dance. They love to dance, so they can dance, they can exercise, they can stretch on this Pandora playlist. And then we have created what we call Fit 5 cards. The Fit 5 program is a program of 5 days of physical activity, 5 bottles of water a day, and 5 fruits and vegetables. And we've created cards and videos for the fitness activities that are translated to a variety of languages, actually, so that our athletes around the globe can go on our website and access these cards. The cards address flexibility, strength, balance, and aerobic fitness. So they can, and the cards go by level, from level 1, which is the least fit, to level 5, which is more fit. So the athletes can actually work in those 5 areas, and they can work on 5 different levels of activity and gradually increase their fitness. It was also important for us to promote emotional health because we knew that the impact of isolation would be more severe on people with intellectual disability. So we have a screening that I'm going to refer to in a few minutes called Strong Minds, which was developed to help athletes cope with stress and relax. And so what Strong Minds did was develop the Take 5 for Strong Minds Challenge. And it encourages the athletes to go online for 5 minutes a day and perform a stress reducing technique. And these would be a yoga technique. We have deep breathing. We've worked with them on developing some stretching for relaxation. positive thinking. There are 5 different areas where they can go and work 5 minutes a day to perform stress reduction. We also developed resources for all parts of the Special Olympics community. So we realized that it was not only the athletes remaining stress-free, but keeping them in a stress-free environment. So we have developed resources for families and caregivers as well, so that they can understand and remain stress-free as well. Strategy 5 was related to our Healthy Athletes event. And for those of you who may not be familiar with it, one of our Special Olympics health components is Healthy Athletes. And Healthy Athletes is a series of free health screenings that we provide to the athlete at games, events, or health fairs. And we have included in Healthy Athletes most of the disciplines that they do not receive necessarily under their insurance. So we have a vision screening, opening eyes. We have a dental screening, special smiles. We have a hearing screening called Healthy Hearing. We have health promotion, which talks about healthy eating, healthy behaviors, but they also do BMI and bone mineral density. Fit Feet, which is podiatric screening. Strong Minds, as I've mentioned, which is coping and stress reduction. MedFest, which is their sports physical, which they have to have before they can participate. And then Fun Fitness, which is what we're involved in, which is a physical therapy fitness screening. We usually have these events in actuality, but secondary to the pandemic, we've not been able to have any actual events. So we began exploring ways that we might offer health education and possibly triage or screenings in the absence of these on-site events. This is a work in process. We've created an educational resources website so that each discipline has put up there an educational resource. We've put up there a falls prevention guide. Special Smiles has put up there how to brush your teeth and floss. Healthy Hearing has put up there how to clean your ears. So there's general health resources. And then each discipline started looking at what we could pilot that could be a virtual form of our screening. Some of the disciplines are not able to do any screening because they require equipment. So they've kind of gravitated toward educational webinars. Some of them have added triage to that. So they're doing a question, you know, do you brush your teeth every day? And then the athlete will answer, and then they will explain why it's important to brush their teeth. So they're combining triage with education. And based on those triage questions, they can do one-on-one follow-up if they identify an issue. So let's say they discover that an athlete stopped brushing their teeth. They could do a one-on-one follow-up and talk to that athlete about why it's important to brush the teeth, how to brush the teeth, etc. Make sure they don't have any mouth pain. So they can combine triage with education and then do follow-up through telehealth. What Fun Fitness has developed is because we have testing, some of which could be done through self-assessment, we've created a self-assessment tool that the athlete and a caregiver can perform at home with a results form. And the tests that we've included for balance are the timed up and go test and the single leg stance test with the eyes open. For strength, the sit to stand test and the partial time sit up test. For flexibility, a modified chair sit and reach, and the athlete scratch test. And then for the athlete who might be in a wheelchair, we've done a seated push-up test and a seated forward reach test, and they can also do the athlete's test. So we've created a manual that explains what this is, explains every test, shows them a picture and a graphic and a video exactly how to do the test, and gives them a results form so they can record their results on the form. We are then working with the Special Olympics programs and the clinical directors in each program to outline how to go through the process. So the program sends out a notice to all the athletes, and the athletes respond if they want to participate. The program then identifies the athletes and their needs regarding a virtual interaction. So is the athlete of a moderate level of disability that they will be able with a caregiver to do the tests on their own and record the results? Or do they need assistance in doing the tests as well as assistance in education? So we've come up with a leveling, 4 levels of defining what the athlete needs. If the athlete needs assistance during the testing, then they arrange a Zoom interaction or a phone interaction with the athlete and the caregiver to do the tests. And then there's a follow-up interaction if they've done the test themselves or if they had guidance with the test between the athlete and the therapist to give them targeted education to improve any areas that need improvement. So right now we're piloting, all the disciplines are piloting this. We've piloted it just in the US to start with, and those pilots are almost completed. And then we will expand it to some global pilots and global expansion. We've tried to do this in mind of what can we use these for once the pandemic is over. So certainly we can use these virtually until the pandemic is completed, but is there a use for them once the pandemic is over? And we realize that there are some athletes who are not able to attend events because of transportation and distance and cost. Or we have athletes who between events have had a change in health status. So these virtual events may ultimately be able to be used for other reasons in the future beyond the pandemic. The last strategy was to help guide them how to return to sports and events. And this was guidance for the programs as well as the athletes and families. So we worked as a group to develop a return to activities protocol. And this was developed for the programs regarding how to return to anything, sports or events. We developed a frequently asked questions page related to that, and many other things returning to activity. How do you travel? How do you track athletes? How do you prepare the venue so that there's some social distancing? How do the coaches make adjustments with the athletes? So there's a huge amount of resources and guidance in returning to activities. But we also developed special return to healthy athletes activities. So we have come up with a general protocol for all the disciplines, and then each discipline has added their own specifics to that protocol so that we're guiding them how to return. So we've started having some activities. We've recently had activities in Estonia and Poland, and they've reduced the numbers. They socially distance, they wear masks, they clean equipment. So many of the things that were discussed this morning, they are actually doing during their events. I've put a list of references for everyone, and also my information if you have questions for me. But basically, in summary, what we've tried to do is to guide our athletes and caregivers and programs through this coronavirus with cessation of activity, a lot of virtual opportunities and understanding, and then gradually return to sport. So I don't know if anyone has questions or if you're taking questions at another time. Okay, thank you very much.
Thank you so much, ma'am. Words are few to show my gratitude. You took out time for us, ma'am. It was very informative and demand of today. You are always the best, and I adore you as always. Physiotherapists and other clinicians often have direct contact with patients, which makes them susceptible to the transmission of infectious diseases. Physiotherapists are also often first contact practitioners, which means that they are in a position to take responsibilities for the early identification of infectious diseases or managing workload in primary care settings. When you get to the end of your rope, tie a knot and hang on. Sometimes we can only find our true direction when we let the wind of change carry us. There is always, always, always something to be thankful for. When we give cheerfully and accept gratefully, everything is blessed. So we are blessed to have Donna ma'am here. So gratitude is a quality similar to electricity. It must be produced and discharged and used up in order to exist at all. Thank you so much for being a silent listeners. We'll meet again tomorrow, sharp 4 p.m. Till then, be informed, be prepared, be smart, and be safe. Be ready to fight COVID 19.
So just before we log off, I have a little announcement. With interest of time, we are postponing the poster presentation for tomorrow's session. So we'll have those paper and poster presentation from the students tomorrow. Thank you.